There's something which came up. Content of this will be sent to the
Third
third
party.
party. What is that?
It's a YouTube recording actually.
Okay, no problem.
It is for YouTube recording purpose, sir. Yes, sir.
Go ahead, go ahead. Video or audio?
So both.
Both, sir.
Good, good. Very nice, very nice.
There's a YouTube link also available for this meeting in case people are not able to join on Zoom.
ना सक
चलो मैडम चालू करते हैं।
So good evening to everybody. Good evening, everybody. On behalf of Indian Society of Anesthetists, Borivali, I invite you all to this very important webinar on mental well-being. We are hearing a lot of suicides, lot of stress amongst youngsters and elderly population, elderly doctors and others also, and even non-medicos. But amongst medicos, I think the stress levels are very high because our profession is related to life and death. So the stress amongst us is much more. And anesthetists are the ones who take the highest brunt. And I think the newly joined anesthetists, the PGs, the residents are really facing a tough time. And we feel that this webinar is a must hear for all of us, for everybody, how to become stress free, how to decrease your stress, how to take part in different hobbies so that your stress levels decrease. I will not take much time. We are also going to have a lecture on organ donation and how to diagnose brain death. We started our tenure as president and secretary, me and Dr. Rao. Our first CME started with organ donation lecture, and again this second tenure second year we want to again promote organ donation awareness and how to diagnose the brain dead. What are the points which help in diagnosing the brain dead? So for that we have a good lecture. So please join in, and I now hand over to Dr. Rajesh Rao, my secretary, and a very dynamic one, and who will be introducing our MOC and our speakers. Over to you, Dr. Rao.
Thank you, madam. Thank you very much. So, as madam has already spoken, this is a very important topic, and we are going to have great speakers to speak on that. It's about mind and the brain also. In the end, we are going to talk about something about brain death also. So, we'll start with the mind game, and the MOC for the event is our own Dr. Yogendra, the dynamic private practitioner practicing for last more than 15 years in Mira Road, Binder area, and he is presently the co-treasurer of our branch. And today he will take us through the journey. He will start with the introduction of speakers, and after each talk, we will have question answer series, which will be taken up. So over to Yogendra. Yogi, you can start the proceedings.
Good evening to all. Today, this topic has been selected, mental well-being. So mental well-being is very much important for us because we, being medical professions, we don't take care of our health at all, even though we are very much in the hospital, but our health is the last priority that we come across. And mental well-being, why? Because 1 out of every 8 individuals is suffering from some or the other mental disorder. It may be either anxiety, depression, or anything. And many of us do not seek medical health, considering it as a taboo, or it may be a stigma. And while it is very effective in preventing and treating the mental disorders, our organization SAMS is also doing a lot on the mental well-being platform. and we may soon have some platform which it will be very helpful for us, and it will help all our anesthesiologist friends as well. Today we have a very renowned psychiatrist with us, who's practicing in Mumbai since past more than 35 years, Harish Shetty sir. He has is an excellent communication skills. He has command over more than 8 languages. He conducts mental health workshop in schools and educational institutes as well. He has worked for mental well-being for the people affected in cyclones, earthquake, riots, and floods. And he is a renowned columnist for Times of India, Midday, Lok Satta, and he has worked with during COVID-19 times for to overcome the depression for the patients suffering from COVID-19. Over to you, Harish Shetty, sir.
Good morning, everybody. It is really an honor and a pleasure to speak to anesthetists. I always believe that anesthetists are like pilots of fighter aircraft, and the fighter aircraft is a very disciplined vehicle, and it gives you a few seconds to correct any anomaly. And you are pilots who are responsible for maintaining lives, saving lives, and behind the curtain with least acknowledgement and praise, without direct contact with the patients. You have been doing this job for a long time. I have tremendous respect for you, and feel that the what you get in your profession is much less than what you should. I've always believed that. I've fought for that as and when I could. So when I start by saying stress management, that's a very loose term. I would like to share that the world has changed. The world has changed. We could see our parents at 5 p.m. in the evening talking, but the point is we have we are in a world where the speed of life is tremendous. When you ride a bicycle, you can say hello. When you drive a Fiat car, you can say hello. But now the speed of life is so tremendous that the body orchestra is challenged, and we live in an era of alienation, disconnection, where every 35 minutes a student dies in India. The highest rate of death of students is in India. Every 9 minutes, a young man or a young woman dies. More girls die under the age of 18 than boys. And we are seeing a spate of suicides in the last few days. I am not going to talk about suicide. I'm not going to talk about illness. I'm going to talk about wellness, how to maintain your health. And the first most important thing which comes to me, and we are experimenting this also, is our being in touch with the 5 elements of the earth. You might find it so simple, but it is so important. When we say that, I would say water, air, sky, wind, and mati. One experiment which we have started is don't come out of the bathroom in 5 minutes, so that you can have your breakfast in 3 minutes and you can rush to the hospital. We are asking doctors, lawyers, judges to play with water a little more than what they did. And remember, the sight of water, the sound of flowing water, and the feel of water is actually relaxing. It brings down the sympathetic drive. It helps sympathetic drive to be aligned with the with the parasympathetic, bringing in some balance inside the body and aligning the body with nature. When I say this, I said this to a bunch of 50 judges today of Myanmar. And they said it's so simple. I said the simplest things are the most profound, and the simplest things are the most difficult to implement. Very difficult to implement. So I would start by saying, play with water. And that is not only science, but it is written in our spiritual text. In the Eastern countries, the 5 elements which you are in touch with is something very important. When I say about those 5 elements, water is easy to manage, but mati, and we work with psychologists who are potters, and we find that a lot of people who cannot share in a closed room are blocked about their past grief, their past past issues, past conflicts, past trauma, when they play with mud, with a psychologist, everything flows because mud is the memory of your ancestors, is the memory of our civilization, is the memory where we are also going to join one day, and we are going to be part of the mud which the earth is made of. So I would say if you're lucky, you can look at the red sun, Agni. If you're lucky, you can feel the breeze. If you're very lucky, you can look at the stars if you can. But water is something which you can play with every day in the bath. Don't rush to come out of the bathroom because your wife or your husband says, "Baहेर या, आता पुष्कळ झालं तुमचं." And that is something important. The second most important thing I would like to share is a data, research data, which is very new and very good. Now, when I say Harvard, you will feel I'm intelligent and you will have more respect for me. But Harvard did something which is so vital. They followed up people for 75 years, more than three generations, to find out what makes people happy. And they found that there are so many findings there, and they should read about it. Two major important findings which are very applicable to us is, one is children who do household chores are better human beings. They have better self-esteem. They have better confidence, and they are emotionally more healthier than us. Manje, if you join BJP, it is very useful. Manje काय? म्हणजे भांडी, झाडू आणि पोता. And those who do bhandi, jhadu and pota, they are much better off than a lot of others. So doing household chores, we always knew it, but Harvard found it with a 75-year-old study across three generations. The second important finding of this Harvard study is very important for all of us. That is, you have to have healthy connection with your friends. We knew it, but healthy connection, this is for people who are above 50, that makes them happy, 45, 50. For the young, they found that fame and money makes them happy. But for a large number of people here who are above 45, healthy connection, what is healthy connection? Healthy connection is in your WhatsApp groups. It's not about your anniversary, my anniversary, your birthday, my birthday, my son has joined MBBS, or is just going up to America to Ivy League school. No, healthy connection is माझी फाटते, मेरी फटती है, मेरी टरकती है, मेरी औरत मेरी बात नहीं सुनती है, मेरा हस्बैंड से मेरा तकलीफ है. And this is healthy connection. Or I'm so happy that I remember that you sent me the first cases when I started my practice, and you were a senior anesthetist, but you helped me start my practice. So sharing of feelings, raw feelings, in a healthy group. Now you will say that, well, we were not comfortable. How will people think? They will judge us. They will do something. Not at all. Today, it's difficult to meet relatives because people are thrown across the world. But professionals are pseudo relatives. It's a family. It's also a family. So what Harvard says is healthy connectivity is something which is extremely important for happiness and for joy. And that is something very important. Now, when you look at happiness, I would like to share there's a difference between happiness and pleasure. Happiness is something you can't chase and you can't avoid. It is like when you're going on the roads, suddenly somebody says, do you remember me? You will say, no. He will say, I know that you had given me anesthesia when my father had a ruptured appendix. They told me your name. I did not see you. I did not meet you after that, but I looked up on the Google and I remember your face. It was you, sir. You saved the long surgery because you kept all the vitals intact and you maintained my father so that the surgeon could operate the ruptured appendix. Now, happiness is something you can't chase and you can't avoid. This is what it is. You can't chase and you can't avoid. Pleasure is something you can chase. हरीश शेट्टी का लेक्चर होने के बाद हम 2 पैग मारेंगे. हरीश शेट्टी का लेक्चर होने के बाद हम लोग साथ में जाके छावा देखेंगे. Whatever it is. So it is so important to understand that happiness is something which you can't chase and you can't avoid. And that is something which I learned, which I would like to share with you. For anesthetists, very specially, anesthetists are very sober people. In their conference also, I see very few people wearing suits and ties. Anesthetists and psychiatrists were very less sensitized because they play with they see life in a difficult phase, and they become humble, and they know their limitations. They are more grounded than, I would say, cardiologists and neurologists and surgeons, by the way, surgeons. So it's so important to understand that healthy connectivity is something we need to really work on. Now, when I say all this, I would like to again bring back a data point which is very important for us. Tibetan refugees across the world has faced more hardships than Americans and many others. But researchers in Harvard found that they did not suffer from depression, anxiety, and PTSD. In spite of being thrown out of Tibet, they spread out across the world. There are many in USA, many in India, and they found that they do something very important. And that very important is that Tibetans are part of the Buddhist practice, and they do a lot of mindfulness exercise. They have community activities which are very strong and very linked, and and researchers have found that in spite of all the stresses, they are healthy. Now, what is it that we need to look at? What is it that we need to learn? I would say we need to learn three things. Number one, look east. Don't look west. Look east. West says Oprah Winfrey show में जो होता है ना, उगता है, share, resolve your friend, you resolve your conflicts. You had an extramarital life. Your wife had an extramarital life, and you feel so hurt. Let's talk it out. Western philosophy, Eastern philosophy, dignity, which means just sit in deep pranayam, deep shavasana, do a few asanas for the mind, conflicts dissolve. The difference between east and west: east resolves, west dissolves. East dissolves, west dissolves. So what we learn from the practice of Tibetans and Buddhists across the world is, can we actually practice a lot of mindfulness? Not essential that you need to go to a class for 4 hours afterwards, but actually mindfulness is what? Mindfulness is eating slowly, loving slowly, talking gently, and not increasing the speed of life, and being more effective. Vipassana, Anapan and Vipassana, Pranayam and Shavasana and other exercises makes you calm, actually brings alignment between the sympathetic and the parasympathetic, and brings alignment between you and nature. But then dance is also meditation. Very important to understand. Singing is also meditation. So any activity which keeps you in a flow state, and you become one with nature, you actually are completely in a flow state. Even giving anesthesia is also a flow state. So a lot of exercises which are practiced in the East is something which will really help you. Coming to feelings, which also is a very important aspect of a life. You should all read the book, not Emotional Intelligence, but the book after that, Emotional Intelligence, Working with Emotional Intelligence, which means what? Which means relationship between thought and feeling, relationship between thought, feeling, and sensation of the body, relationship between thought, feeling, sensation, and also behavior, which would actually mean what? It would mean that we all get automatic thoughts, automatic feelings, automatic sensations, and it helps us to understand. Say, for example, हरीश शेट्टी आने वाला है, ऑटोमेटिक थॉट, साला पकाएगा. ऑटोमेटिक फीलिंग, यार फिर से ये प्रवचन देगा यार, दिमाग का गुस्सा बन जाएगा. सेंसेशन, यार स्टमक में मेरे को कुछ तो होता है. बिहेवियर, म्यूट करके एक्टिंग करो कि तुम सुन रहे हैं, तुम एक्चुअली कुछ और कर रहे हैं. पॉइंट अमाउंट में ऑटोमेटिक, पीपल हु आर एबल टू वॉच योर ऑटोमेटिक थॉट्स. फोन आया ऑफ अ सर्जन, वो साला पैसा कम देता है हर बार, फिर भी तुम 20 साल से उसके साथ काम कर. ऑटोमेटिक थॉट, बदमाश है, फिर भी मैं उधर जाऊंगा, फिर भी मैं जाके काम करूंगा. अंदर से ऑटोमेटिक थॉट, बदमाश है. A good surgeon who respects you, automatic thought, I love to go there. He's honest, he's very fair, and I feel very nice. Automatic feelings, I feel joyous, I feel nice. Automatic thoughts, he's a nice man. Automatic sensation, feel nice in the body. An automatic behavior, you go with full attention and you focus on the task and are happy to do whatever you are doing. So people who are able to watch their automatic thoughts, they don't respond through the amygdaloid. In the sense, if you are doing any practice of meditation, it could be tasbih also, it could be rosary, it could be Sadhguru's meditation or Sri Sri Ravi Shankar, yoga, any form of meditation, Preksha Dhyana, any form. What you do is you calm down your hypothalamo-pituitary system, you bring down the cortisol rain in the brain, you bring down obesity, you maintain the orchestra of the body. And when you maintain the orchestra of the body, the pancreas will not go on strike, it will give you insulin. Thyroid will say, Le, kitna mangta hai, utna hormone le, apun shant hai. Calcium says, I will not get deposited in the coronary artery. And stomach says, my acid nahi dunga ja. So resetting your body, use whatever methods you can. And that is something so important, my dear friends. And whatever method, you can sing, you can dance, you can sit down and meditate, you can run, you can jog. Whatever gives you a flow state will bring alignment. And what is happening in 21st century is malalignment of the body inside and malalignment of the body with nature. Do you know, my dear friends, children in jungles are much calmer than children in concrete jungles. Because children in jungles are in touch with the five elements openly. The calmer, go to school. I go to school across the country. Number two, children who are in schools which have some form of Eastern activity are much calmer at the age of 15 to 18 than children who are not in touch with any Eastern activity, and they actually live on pizzas, they actually live on other things. Children in lower middle class schools are much calmer, much grounded because they help their mothers in their household work. They do household work and they're much calmer and they're much grounded. As I slowly go ahead and I finish in 5 minutes because my time, I should keep my time. Now, it is important to understand that there is no competition on this earth. Competition is an artificial thing. So jealousy plays a very important role in causing stress. And and Buddha said mudita. Mudita is sympathetic joy at somebody's a good activity, somebody's success. And we do these workshops from jealousy to joyfulness. अरे यार उसने नया घर लिया, आणि तुम्हारा हस्बैंड या औरत बोलता तूने क्या किया 20 साल से, क्या झक मारा? अरे ठीक है ना यार, दाल रोटी मिलता है, चिकन मिलता है, श्रीखंड मिलता है, पनीर मिलता है. You are in the top 10% of the Indian population. Will you avoid the invite because you feel jealous? No, you will go and hug the friend and say, my God, I'm so proud of you, I'm so happy. You might not feel so inside. You might feel 10%, but if you do that again and again, abhinay karte karte, jealousy come ho jata hai and the mind gets aligned, and that is so important. So jealousy to joyfulness, at sympathetic joy at people's success, accepting it and holding yourself close. Last few thoughts about marriage. Remember, there is no difference between love marriage and arranged marriage. Okay, love marriage is heart to the hip, arranged marriage is hip to the heart. You come back from honeymoon and start saying, I love you. You don't know the person. Still you say, I love you, I love you. And ultimately, kya marriage is what? Marriage is finding the best available at that point of time, and you can't upgrade her or him. वैसे ही रहेगा वो. So, so the point is, marital health is very important for mental health, and which means तुम्हारा बाजू में सोया वही तुम्हारी अनामिका, तुम्हारे इस तरफ जो सोया वही तुम्हारा अमिताभ. कुछ भी हो साला, तुम्हारा बाल कम हो गया, तुम्हारा तोंद आया, साइज चेंज हो गया, शेप चेंज हो गया, वही इच्छा है. So three things which you should do for in marriage, other things you all know. When you leave your house, please give a nice good hug to your spouse if she's alive. If you're single, please give a nice good hug to your mother or yours or anybody, or a pillow also. And whatever is the problem in the family, सासू का अपने को पैसा नहीं मिला, सासरे का पैसा नहीं मिला, कुछ भी झगड़ा है, तो भी काम पे जाते वक्त एकदम चमको चमको झप्पी मारने का. Because you know why? Soft touch and small talk changes the brain. Soft touch and small talk as important as hard touch and hard talk. So this, and आने के बाद भी Men are terrible in India. They pretend as if the world is on their shoulders and they have bhopada face. And they come back, wife should know how hard I work. अरे छोड़ो यार, गेट इन टू योर शॉर्ट्स एंड आने के बाद भी चप्पी देने का। ऐसा मुझे एक आईपीएस ऑफिसर ने बोला इन लेक्चर। मैंने बोला सिर्फ जाते वक्त दो, बोलते नहीं सर, आने के बाद भी देना चाहिए। दैट्स वन। Number two, soft touch and small talk is better than hard touch and hot talk, or as good. Before sleeping, cuddling, कुरवाळणे केलं आवश्यक आहे. केश नसेल तरी असं असं करायचं नवऱ्याचं, आणि बायको पण असं असं करायचं. कितीही भांडण असो, 5-10 मिनिट कुरवाळणे करणं अगदी आवश्यक आहे. आणि कुरवाळणी करताना दात घासून करायचं, नाहीतर बास येणार. It is so important, my dear friends, that this brings people together. And the last thing is, you see your kids seeing you and your husband or you and your wife close, wherein the wife puts the head on husband's lap and sits and chats, small talk, soft touch and small talk. And they also their emotional development is so good if you do that. I've checked with Shankaracharya, I've checked with Pope, and I checked with Mac also. They've all approved it. So this is something very simple. Lastly, I would like to say something very, very important. My dear friends, what are we fighting? We are fighting the disconnection caused by the globalized world. भेटणं बंद होतंय, फोनवर आपण अटकलोय, ऑनलाईन ऑफलाईन ऑनलाईन ऑनलाईन मध्ये आपल्याला आनंद येते. Our answer to this is reconnection, which means see that your festivals are celebrated with fun and with a lot of health. So reconnect in your mohallas, in your buildings, among your relatives during festivals. Festivals is the most beautiful thing on the earth, and that is something important. At the same time, teach them Indian history. Teach them Indian history. Let you go and see Chava. Inform them who was Lachit Borphukan. Inform them who was Birsa Munda. Inform them the biggest rock temple of India is in Aurangabad or Sambhajinagar. Take your kids to places of historical importance where they become proud of our culture, our background, because civilizational awakening is happening, and civilizational awakening improves self-esteem and activity. Lastly, when anybody is in crisis, don't look from far. JJ का साला उसको कुछ आता नहीं, नायर का साला वो केएम का नहीं है, उसको क्या आता है? अरे अभी विंडोज करने को इतना फटती है, उसके हाथ इतना हिलता है, नहीं। उसकी घोची हुआ कभी भी तुम्हारे साथ भी घोची हो सकता है. His gochi is my gochi, and we'll hug him, we'll help him, and we'll be together. As I finish, I would say the biggest message I've learned in COVID is this: when everybody is safe, I'm safe. That's the biggest lesson I've heard in COVID. And that is what we need to believe. If all the anesthetists are safe, I'm safe. And we need to build this cosmic connection and see to it that we all are connected in some ways. We respect each other and we help each other during a crisis. And in the WhatsApp group, please share your raw emotions in a safe space, and see to it that you don't hold it too long for your entire body and your entire orchestra to be disrupted. With this, I stop. Thank you guys for inviting me. I'm extremely happy. I have 7 minutes or 8 minutes for Q&A because we started a little late. We started at 6:34, if I'm right. Thank you, Yogendra. Thank you,
Yes, sir.
and a
Thank you, sir.
special thanks to Rajiv Garud, my real old friend. He's the same. He's very methodical. He's very precise. He's very organized. साला इतना organized है वो. And thank you, Amula and Dr. Rao, Rajesh Rao, and Yogendra and others. Thank you.
Thank you. Thank you very much, sir, for your wonderful talk. As usual, you have been all the best. And so some questions are still left. So we as an anesthesiologist, we come across a lot of stress and lot of pressure in the OT. Our means whole of the process of OT induction to reversal, everything is very, very stressful. Supposingly, if some untoward event happens during a surgery, so how do we deal with it and how should we go about it? Because that is one of the worst things that any anesthesiologist or any person can come across whenever anyone is in an OT. Firstly, the patient comes in the OT walking, or the patient is conscious oriented and everything comes. And if some untoward event happens, and the patient is wheeled back in the ICU or some fatal event happens, how do we deal with that, or how do we come across it, sir?
Five things which are important. Before you start OT, do 5 minutes of breathing or pranayam. See to it that you have an honest relationship with the doctor. He will not dump you after the operation. Second is insist on speaking to the patient with whom you're going to give anesthesia before the surgery, and tell the surgeon, मेरे को सिर्फ 5 मिनट बात करने का. I will not inform him about the fees which I take, because you're going to cut the fees and cut and then give me little. But I would like to say, make yourself comfortable with the patient. He gets comfortable with you. A lot of comfort between each other and a lot of faith between each other actually brings down a lot of conflict. Number three, if before the ECT, I ask my anesthetist to speak to my patient and ask them and allow them to ask all questions and give them very scientific advice of what are the basic probable anticipated accidents. Is it high risk? Don't say sab theek ho jayega. Hum hai na. Don't do hum hai na business at all. It's very bad. This is what it is. I'm going to try my best. In the past 15 years I've been working, I've been able to handle this much better. Probability of something happening is very less, but the possibility is always there. It's something you need to talk to the ally. Ally means in one family there's a decision maker who's the big guy. He controls the family. He controls the temper of the family, controls the emotion of the family. You have to talk to the ally, not talk to everybody. Talk to the ally and see to it that he absorbs what you're saying, and then you go to the OT. Unfortunately, even in the best hands and even in the most ordinary case, ordinary illness, patients die on the table. And this is what happens. At that point of time, see to it that you call few of your friends so that you share at that point of time, and you see to it that you actually prepare to tell them honestly what happened as far as possible, and see that the discrepancy between the surgeon and the anesthetist will not happen. This is what it is. We tried this, but unfortunately his BP fell. We tried to revive it with this did not come up, and unfortunately he had to be wheeled to the ICU. But at that point of time, the patients' families are not hostile. Allow them to express whatever they want and see to it that you answer all the questions. But if the patient's family is hostile, then you have to have somebody tough to to speak to them, and you don't get exposed at that point of time, because people throw all their frustrations on the doctors and teachers. And the last thing, which is very important, is when things go wrong, and if they go away to the ICU and they are being treated by a physician now and not a surgeon or intensivist, sometimes go and talk to the close relatives if the rapport is good, and see to it that you keep in touch with the relative till the time that they leave the hospital, or till the time they don't go vertically, they go horizontally. And if they come back to you and say, "ये क्यों हुआ? ये कैसा हुआ?" Let them tell what they feel. You tell them, actually, we do not know why it happened to him. It happens in 5% of cases. It happens in 0.1% of cases. And this is what it is. And always work in pairs. Don't work alone. मैं किसी को नहीं बोलेगा मेरा ये सब झंझट आपको नहीं संभालेगा. No. Always have one person. A Siberian crane always travels in pairs. Work in pairs, and you need to have somebody with whom you actually would talk to.
Yes, sir.
Thank you for that question. But see that you are all together. If there's a very hostile patient, see that you involve the police. I have faced all this in my hospital. Harish Bhatt is a physician. One patient died of 1 day fever. They threw stones at the hospital, and the cop came there from Parla police station. तुझा hospital बंद करना. I said, I don't get scared, and I kept quiet, and I that it's good to have good connections. I spoke to the DCP. I said, this is what he's doing. Is this his job? Hospital banda karacha. And I told him, sit down. I said, these things can happen anywhere. And 1 day fever, patient died. We do not know why. We have kept all his secretions. We have kept all his blood. We'll send everything. And I'm not going to give you any death certificate. He should go undergo postmortem. Then what happens? 2-3 दिन ऐसे आड़ा टेढ़ा शिवसेना, UBT, शिवसेना, वो they call come. But keep your cool and see that they should see to you that you are powerful and you are connected. Very important. You have a nuisance value is very important. Then you being kind and compassionate. Don't be mindless. kind, mindlessly kind, be mindfully kind. आपलं आपलं पण ओळख आहे. And that is very important to have in this era. Don't be isolated. See that you use all your connections to protect yourself. But the basics which I have said, you should always do it. We have faced all this, and blind guts, ability to connect and communicate and listen. Even if they go back and feel that नहीं तुमने कुछ किया होगा गड़बड़, ठीक है यार, बट हमने अपना ऑनेस्टली हमने काम किया, ऑनेस्टली आपको बताया, और ऑनेस्टली हमने जो कुछ हमको प्रोटेक्ट करने के लिए करना चाहिए तो हमने किया. Don't become Mahatma Gandhi. Become Chhatrapati Shivaji. 395th anniversary we celebrated recently.
Yes, sir. So supposingly an event has happened, 1 to 2 days have passed by, all the things, paper and all has settled down, but that story keeps haunting us for days to months and to years as well, sir. So that is a
So
big thing. And how
what
to
is
come about it?
important? Yeah. What is important is the stories that haunt are the stories which have very tight feelings. Say, for example, the story that also comes back is your first love and your first kiss and your experiences of affection with your mother, father, or your wife or your husband. That also is there. Why? It remains all your life. Why? Because it has a lot of beautiful feelings. Similarly, painful stories remain, and we need to quarantine it because it has a lot of feelings: anger, jealousy, fear, looking down at yourself, अरे मेरे हाथ से ऐसा क्यों हो गया? And that feelings really keeps the stories alive, and you may get dreams, memories, and intrusive thoughts. And some people have stopped practicing anesthesia. They have not met Harish Shetty or some good psychiatrist, so they have not met good friends. I would say that quarantining the story is the first step, which means what are the feelings I get? I feel scared. I feel low about it. I don't know why it happened. Ask yourself, how many operations you have done till now? I've operated 15 years, and what is the exact statistics of things which have gone wrong? Very rare. Probability of this happening is very rare, and it has happened once. You are not completely responsible for it, and across time, you have done good work across time. These are things which happen once or twice, so the feeling slowly settles on. At the same time, share your raw feelings with your friend. बैठ के चाय पियो और बोलो साला उस दिन मेरी इतनी फटी थी, मेरे को इतना गुस्सा है, साला वो ऐसे लगा, वो रिलेटिव मेरे ऊपर कुछ बोलता था, ऐसे लगा उसे गला दबा दूं साला, इतना गुस्सा है. Share your raw feelings with your friends. The third thing which you do is always understand that your spouse is intuitive, even if he or she is not aware of तुम्हारा anesthesia. जाके उसके बाहों में रोने का. The best place to cry is the baho of your own spouse, not somebody else's spouse. And that also helps. काय तू अशी लहान का तुमची प्रॅक्टिस काय तुला बंद सांगितलं ना, तुला बंद करायला प्रॅक्टिस काय सगळं करते तू, घरी बसणं चायला. नाही रे, मला डॉक्टर हरीश शेट्टी भेटले होते, आणि हरीश शेट्टी म्हणजे कोण? महर्षी हरीश शेट्टी. त्याने सांगितलं तुझं कुशीवर मला रडायचं आहे. टीच दॅट ड्राय हजबंड or a dry wife, the best place to cry is in each other's home. And the fourth thing is take a feedback. I still remember the death conference which used to happen in Nair Hospital in Dr. Agarwal's, R.K. Anand's, and Poddar's unit. They would completely dissect the case step by step and find out if they could improvise next time. And so it's important to have this feedback activity with your friends and debate, reflect. And the fifth thing is settling down. म्हणजे काय, majority of times I've done great work. This happened, I do not know why. Probably I erred, but I did not do it with any motive. Error, emotion among with errors is not as bad. Emotion motive is suppressed. So I would like to do these things very differently in these cases. If I hold my emotions, I'll get so paralyzed, I get so phobic that I will not operate, or I will avoid these cases, or I'll avoid that OT, or I'll avoid that surgeon. So it's important to do this exercise with yourself, with friends, with your spouse, and don't allow the stories to fester with emotions. Stories fester because emotions are entangled. When you release the emotions, when you allow the emotions to die, the story gets quarantined, and it becomes a memory which is not which will not affect you in the long run. But if it's really very bad that it still comes back, then you should take psychotherapy or a small dose of antidepressant, which is very important. Thank you, Yugen.
So there's one more question on the board. What is the reason for increase in the number of divorce cases in India in the recent times?
No, I think there are five reasons. Number one is that men and women don't meet; they bump into each other. So they find that after 5 years, somebody is much better than this and a compatibility. So the women are empowered and they are not willing to take shit anymore, which is one. They don't adjust and tolerate. But men and women should understand that a boyfriend is good outside, but when he becomes husband, girlfriend is good outside. When she becomes a wife, same hai. वही होठ, वही नाक, वही हाथ, वही उंगलियां. So it's important to understand that even if you marry Sunny Leon or Vicky Kaushal, after some time you'll get bored. So you need to really maintain the balance. That's number one. Number two, financial empowerment of women. If they are earning, they feel that they should not stay together. They could have a much better life. And there are simple reasons for divorce. I think what is important is there is no shame or there is no shame in divorce. There's no fame. There's no shame. If somebody tried their best to be together and they can't, they should actually separate. No harm at all. Number three, which is very important, is technological divorce. One SMS, I love you, from anybody breaks a family. And there it is important that you should go to marriage repair garage. That's a good marriage counselor who can repair your marriage, and that is something you can actually do. Technological is important. Earlier, all the men and women would meet in the grass and make love in the villages, in that sugarcane farm, because the sugar canes are tall and people would, there's no evidence. Everything has evidence. Kids put WhatsApp tracker on their mother's phone and father's phone to find out what the hell they're doing. And they inform the other, देख तुम्हारा husband या तुम्हारा wife तुमको cheat कर रहा है. So technological divorce. And the fourth is ahankari divorce. People believe that they don't understand the expectations. What are the expectations of marriage? Don't try to convert, change your husband or your wife. There are some things they will not change. They will remain as they are. So it is important to understand what are your expectations and what sort of communication. Fifth is to understand what is marriage. Marriage is lip to lip, heart to heart, hip to hip, and marriage mind to mind, लिप टू लिप, हार्ट टू हार्ट एंड हिप टू हिप. 50% इज पासिंग परसेंटेज. कौन सा 50% तुमको अच्छा लगता है वो तुम एक्सेप्ट करो. बट द मोस्ट इंपॉर्टेंट थिंग टू प्रिवेंट डिवोर्स इज कांस्टेंट कम्युनिकेशन. मेरे को वो डॉक्टर बहुत अच्छा लगता है, बोलने में कोई दिक्कत नहीं है. वो अंदर से छुपाएगा तकलीफ होता है. मेरे को तेरा ये नहीं अच्छा लगता है आजकल, मेरे को तेरा ये बहुत अच्छा लगता है. A lot of people are irritable in marriage. Husbands complain, wife is irritable. Wife complains, husband is not talking. बॉस घर पे जाके कार्ड फेंक देने का, आंबो बॅग उधर फेकणे का. सीधा तीन गोष्टी करायची. झप्पी बिफोर गोईंग, झप्पी आफ्टर कमिंग, कुरवाळणे अँड लॅपटॉप फिलॉसॉफी. त्याची मुंडी माझी मांडीवर, माझी मुंडी ह्याची मांडीवर. आणि सासू सासरा असेल तर चालेल, त्यांना सांगा हरीश शेट्टी भेटले होते, त्यांनी सांगितलं. हे बघा, शिल्पा इज टेलिंग हर हस्बंड.
Yes, that's to me.
And Yogendra, marriage boredom is normal in marriage unless you see to it that it is worked on. It's like a car, no maintenance करना. उसको ऑयल लेट साला डालेगा, गाड़ी बीच में बंद पड़ता है. तो मेंटेनेंस करना चाहिए फटाफट, साफ सफाई करना, वो सब करना चाहिए. और अल्टीमेटली क्या है, अपने बाजू में जो सोई है वही तुम्हारी अनारकली. ताटाचा बाहेरचा आहे ना जेवण उष्ट असतो. And by the way, don't think and hide all that. Lovers are blind, but the world is not blind. टेक्नोलॉजिकल डिवोर्स वेरी कॉमन. संभालो अपना व्हाट्सएप, क्लोन करके ट्रैकर डाल के तुम्हारा बच्चा पूरा चार्ट निकाल के हस्बैंड को या पापा को मम्मी को देगा. किड्स आर द बिगेस्ट स्पाइस. किड्स का हाथ में फोन दिया, कुछ भी कर सकता हूँ. So I'm okay with divorce if things don't go right, because women are financially empowered. They would want to stay away. दे देने का. Or when you take a divorce, remember three things. You might be separated matrimonially, but parenting you should not hassle. Divided in matrimony, united in parenting. Second thing, a child needs a healthy parent, one healthy parent to grow. It's not essential that they need both healthy parents, one healthy parent. And the third thing, marriage is a union of two forgivers. ये तीन सेंटेंस को रखो याद, फिर सब गाड़ी ठीक रहे। और मैरिज और हुआ, समझो डिवोर्स हुआ तो कोई आई एम वीक, आई एम नॉट गुड, ऐसा नहीं होता है यार। फ्रिज नहीं चला, कुछ साल के बाद अपने को चेंज करना है, क्या कर सकता है। कोई शान नहीं, कोई शर्म नहीं, कोई फेम नहीं, कोई शेम नहीं।
Sir, grey divorce,
हम्म?
grey divorce,
What is-
मतलब after 30-40 years
अरे
of
कॉमन है।
marriage,
अरे
grey divorce.
बाबा, मेरा एक साला एक पेशेंट 75 ईयर ओल्ड आदमी उसका औरत को बोला, मैं जब 45 में था तो मेरा एक अफेयर था। मैं बोला गांडा साला, अभी तुम बोलते हैं सब। I was Gujarati. I told him, Gando Chetu. She went and filed a divorce and she got a divorce. After divorce, she died after 6 months. Oh, very common. It is terrible. I mean, great divorce is so terrible in the court. You know what happens? They don't hire a lawyer. They argue that case on their own. इतना judge लोग भड़कता है, इतना भड़कता है. But the point is क्या है, अभी लोगों की अपेक्षा है, लोगों का चॉइसेस है, हम एक्सेप्ट करेगा ऐसा नहीं है ना, तो क्या कर सकते हैं, होने वाला है। बट एज लॉन्ग एज फाइनेंशियली दे आर ओके, दे आर इट्स ओके। बट आई व्हाट आई डू इज, सी, you have lived 75 years, you live 25 years maximum. If you want to vote, Modi's grandchild will become the PM. तो ऐसा जब होएगा तो अभी तुमको क्या करने का, वानप्रस्थ आश्रम है, अभी तुम्हारा सेक्स लाइफ भी थोड़ा कम हो गया, स्पिरिचुअल मैरिज करो एंड बातचीत करो, हक करो, घूमो फिरो, चुम्मा दो जितना हो सके, और हाथ पकड़ के घूमो, मेक द बेस्ट ऑफ योर मेमोरीज, ग्रैंड पेरेंट्स का सुख लो। मैं बोलता हूँ, बट क्या है, फिर भी कोई क्या है, देर आर मेनी डिवोर्स्ड हस्बैंड, डिवोर्स्ड वाइफ्स एंड डिवोर्स्ड हस्बैंड, दे इंस्टिगेट दो 75 ईयर ओल्ड, नहीं अपना अपना राइट है, अपना ये है। अरे साला 75 में अकेला किधर जाके जिएगा यार, अच्छा नहीं रहता है। अच्छा, थोड़ा खड़ूस वाइफ होगा तो क्या हो गया, इट्स बेटर देन हैविंग हैविंग नो वाइफ। थोड़ा खड़ूस हस्बैंड हुआ तो क्या हो गया, बेटर देन हैविंग नो हस्बैंड। दे से नो एब्सेंट अब्यूज, माइल्डली अब्यूजिव हस्बैंड और वाइफ इज मच बेटर देन एब्सेंट हस्बैंड और एब्सेंट वाइफ। ऐसा तो है।
Thank you, sir.
दानिश उधर वो रहा, he might be waiting. I have to go and catch a flight now to go back.
Okay. Thank you, sir. Thanks a lot.
Thanks.
Thanks for your words of
Yogendra,
wisdom.
Dr. Rao, Rajiv, Amula Ben, thank you. Shilpa Tai, Namaskar, Kajal, all those who are
Namaskar.
there on the show, Namaskar, and wish you good life. But see to it that सबका फटेगा, किसका भी मन का फ्रैक्चर हो सकता है। फ्रैक्चर हुआ, डिप्रेशन हुआ तो गोली खाने का। अमिताभ बच्चन ने बोला था, 2 बूंद जिंदगी की, अपन बोलने का एक गोली खुशी खाने का, डेक्सिड खाने का, एसिडोरम खाने, बिंदास खाने का। मैंने खाया है 23 के एज में। राजू मालूम मेरा ब्रेकअप हुआ था, उस समय मैं इमिप्रोनिन खाया था। बाय, गुड नाइट, टेक केयर।
Thank you.
Thank you
Thank
very
you,
much.
sir. Thank you so much.
Bye.
We can keep hearing
Bye,
you
bye.
forever,
Thank you.
I think.
Yes, thank you, sir. It
Thank
was
you.
really pleasure.
After Harish Shetty sir's talk, we have a very well-renowned psychiatrist with us. He's practicing in the western suburbs since a long time, almost 2 decades. Dr. Shakib Danish sir. He is the president of Mira Road Medical Association of Family Physicians. He is the president of Healthy Mind Foundation. He is the trustee and executive committee member of Thane Psychiatry Society. He has special interest in de-addiction and sexual problems related things, and he is a wonderful orator. Welcome to this forum, Shakib Danish sir.
Thank you very much. Thank you very much. Screen share. First of all, I would like to thank the Anesthesia Society for giving me opportunity to give this lecture. सर का इतना सब कुछ सुनने के बाद अभी कुछ प्यास अगर बाकी है तो वो मैं पूरा कर देता हूँ। सबसे पहले एक शेर कहूंगा मैं, जो एनेस्थीसिया प्रोफेशन के लिए बहुत सूट है और हमारे लेक्चर के लिए बहुत सूटेड है। अजनबी शहर के अजनबी रास्ते मेरी तन्हाई पर मुस्कुराते रहें। मैं बहुत देर तक यूं ही चलता रहा, तुम बहुत देर तक याद आते रहें। जहर मिलता रहा, जहर पीते रहें, रोज मरते रहें, रोज जीते रहें। जिंदगी भी हमें आजमाती रही और हम भी उसे आजमाते रहें। जख्म जब भी कोई जहन दिल पे लगा, जिंदगी की तरफ एक दरीचा खुला। गोया हम भी किसी सांस के तार हैं, चोट खाते रहें, गुनगुनाते रहें। कल कुछ ऐसा हुआ, मैं बहुत थक गया, सुन के भी मैं उसे अनसुनी कर गया। कितनी यादों के भटके हुए कारवां, दिल के जख्मों के दर्द खटखटाते रहे। सबसे पहले मैं कहूंगा, भूल देने वालों खुद को ना भूलना। आवाज आ रही ना मेरी?
यस सर।
हाँ। भूल देने वालों खुद को ना भूलना। आप लोग सबको भूल देते हैं, खुद को मत भूलिए। कितने सारे एनेस्थेटिस्ट हैं जो कि डिप्रेशन में हैं और प्रॉब्लम से इश्यूज हैं, बिकॉज दे आर नॉट केयरिंग अबाउट देमसेल्फ। जितना आप एनेस्थीसिया की ट्रॉली को केयर करते हैं, उससे ज्यादा आप अपने आप को केयर कीजिए, बिकॉज लाइफ इज ए क्रिकेट मैच। बहुत सारे एनालिसिस, हमारे तेजवीर सर है, बहुत सारे एनालिसिस हैं जो कि क्रिकेट में बहुत इंटरेस्ट लेते हैं, इसलिए बता रहा हूँ। प्ले लाइक ए टेस्ट, डू नॉट प्ले लाइक T20। जैसे सर ने भी बोला, लाइफ को स्लो मोशन में जीने, दो इनिंग रखने का, प्रोफेशनल एंड पर्सनल। प्रोफेशनल इनिंग अलग और पर्सनल इनिंग अलग। घर में जब आए तो हम बेटे के बाप हैं, वाइफ के हस्बैंड हैं, हस्बैंड के वाइफ हैं, और बाप के बेटे हैं, बेटे के बाप, ऐसा रहे। घर में आके अपने प्रोफेशनल वरीज भूल जाने, मोबाइल स्विच ऑफ कर देने का, जैसे ने बताया ग्राउंडेड हो जाने का, वाइफ को झप्पी देने का, बच्चे को हेलो हाई कहने का। घर में आने के बाद ओटी का टेंशन नहीं लेके आना, और प्रोफेशनल पे गए तो घर का टेंशन नहीं लेके जाना है। तो प्रोफेशनल और पर्सनल लाइफ को अलग अलग रखना है। एनेस्थीसिया इज टू रिलीव पेन, बट एनेस्थेटिस्ट कितने पेन में रहता है, वो आज जैसे सर ने बताया, आप लोगों ने बताया कि कितना स्ट्रेस, कितना ट्रॉमा रहता है। क्योंकि डिसीजंस जो होते हैं ना एनेस्थीसिया में, वो लाइफ एंड डेथ के डिसीजंस होते हैं। और प्रोलॉन्ग टाइम तक, जो लंबी सर्जरीज है उसमें काफी टाइम तक फोकस, कंसंट्रेट, वाइटल्स मेंटेन करना पड़ता है, जिसकी वजह से फिजिकल, इमोशनल और कॉग्निटिव फैटिग हो जाती है। इसकी वजह से बर्न आउट भी हो जाता है। बर्न आउट की क्या सिम्टम्स? अगर हमें ऐसा लगे काम में मन नहीं लगा, जिस काम को हम पहले इंजॉय करते थे उसको इंजॉय नहीं कर रहे हैं, प्लस फैटिग, बोर्डम, और डिरियलाइजेशन, कह रहे अभी मैं कहाँ हूँ, किधर जाना है, फोकस नहीं कर पा रहे हैं, प्लस थकावट, अन अनएक्सपेक्टेड थकावट, एनर्जी नहीं मिलना, ये सब बर्न डाउन के सिम्टम्स है। एंड अनप्रिडिक्टेबिलिटी कितना है एनेस्थीसिया में, इंसान जाता है चल के और एकदम व्हील चेयर पे आ जाता है या फिर आईसीयू में चला जाता है, डेथ हो जाता है। तो अनप्रिडिक्टेबिलिटी कॉजेज एंजाइटी, स्ट्रेस एंड जॉब डिससेटिस्फैक्शन। तो अब हमें क्या चेंजेस लाने हैं लाइफ में, इसकी वजह से हम सेटिस्फाइड रहें और हम फोकस कर सके लाइफ में, इसके लिए मैं एक पॉइंट बताऊंगा। पहला पॉइंट, यू मस्ट हैव ए पर्पस ऑफ लाइफ। जैसे मैंने बोला, स्पिरिचुअलिटी इज मस्ट। अपने लाइफ में हेल्थ क्या है? इज स्टेट ऑफ फिजिकल, मेंटल, सोशल एंड इमोशनल वेलबींग। इसमें हमारा 1/4 स्टेट जो है वो मेंटल है, 1/4 जो है वो स्पिरिचुअल है, और 1/4 जो है वो हेल्थ, फिजिकल हेल्थ है। हम अपने हेल्थ को एज अ टोटल देखें, फिजिकल, मेंटल, स्पिरिचुअल एंड इमोशनल वेलबींग। अपने इमोशनल वेलबींग के लिए हम क्या करते हैं? कभी टेंशन आया तो कुछ नींद की दवाइयां खा ली, और कुछ कभी बात कर लिया, लेकिन फोकस नहीं कर पाते। इसके लिए हमको एक लाइफ का पर्पस होना चाहिए। हम क्यों एनेस्थीसिया लिए? मिल गया मुझे, इससे मिल गया, इंटरेस्ट मिल गया, या फिर हमें कुछ करना है लाइफ में, किसी की लाइफ को पेन फ्री बनाना है, ऑपरेशन में मदद करना है, एक हायर पर्पस होना चाहिए लाइफ। अब जब ऑपरेशन में रहे तो हमारा स्ट्रक्चर्ड वर्क फ्लो रहेगा, प्रोटोकॉल्स रहेंगे, उससे एफिशिएंसी बढ़ जाएगा। और चेकलिस्ट रहे, डीप ब्रीफ सेशंस रहे, जिसकी वजह से हमारे कॉम्प्लेक्स प्रोसीजर्स में भी हमको आसानी होगी। When I in illness is replaced by we, when illness becomes wellness. तो हमको टीम वर्क करना है, अकेला काम नहीं करना है। टाइगर इज नॉट द किंग ऑफ जंगल, लॉन इज द किंग ऑफ जंगल बिकॉज इट वर्क्स ही वर्क्स इन टीम। इसके लिए हमको टीम वर्क में काम करना है, हमेशा मिल के काम करना है। दुख बांटने से कम होता है और सुख बांटने से बढ़ता है। इसके लिए हम अपने फीलिंग्स को शेयर करें, जैसे हमने बताया रॉ फीलिंग्स को शेयर करें। मोबाइल पर क्या होता है कि प्रोफेशनल फीलिंग शेयर होते हैं, सोफिस्टिकेटेड फीलिंग शेयर, लेकिन जो रॉ फीलिंग्स है हमारे, जिससे कि हम हमारा दिल का दुखड़ा हम रोए। साइकियाट्रिस्ट के पास आके पेशेंट्स दुखड़ा रोते हैं, बोलते हैं मेरे हस्बैंड को बाहर करो, मेरे बेटे को बाहर करो, मुझे आपसे बात करनी है। कितने पेशेंट तो ऐसा बोलते हैं कि आप सुनेंगे ना मेरी बात, आप सुनेंगे ना मेरी बात, हाथ पकड़ लेंगे, आप मेरी बात सुनो, आपको जितना पैसा चाहिए मैं दे दूंगा, आप बस बात सुनो मेरी। इसलिए हर क्लिनिशियन के टेबल पे एक टिश्यू पेपर होना चाहिए, ताकि उसको जब रोना आए तो उसको टिश्यू पेपर दे दो। इसकी ये भी एक बहुत जरूरी प्रैक्टिस का एक हिस्सा है। स्माइल इवन इफ यू डू नॉट लाइक द सब्जेक्ट, जैसे सर ने बताया, स्माइल इज मोर पावरफुल ड्रग देन केटामिन एंड प्रोपोफॉल। टू बी ए गुड डॉक्टर यू मस्ट फर्स्ट टेक केयर ऑफ योरसेल्फ। जैसे हम बोलते हैं ना कि डॉक्टर सेफ्टी बिफोर पेशेंट सेफ्टी, वैसे डॉक्टर्स केयर बिफोर पेशेंट्स केयर। अपना हेल्थ, अपना हाइजीन, अपनी मेंटल वेलबींग जरूरी है, तभी हम दूसरे का केयर कर सकते हैं। दूसरे की इमोशन से हम ड्रेन ना हो जाए, बल्कि अपनी इमोशंस को हम कंट्रोल रख सकते। ए बर्न्ड आउट डॉक्टर विल नॉट हील अदर्स, ऐसे जैसे कार कैन नॉट रन ऑन ए फ्लैट टायर। सो सेल्फ केयर इज मस्ट बिफोर पेशेंट केयर, डॉक्टर सेफ्टी बिफोर पेशेंट सेफ्टी। अब उसके लिए क्या करना चाहिए? लर्न टू से नो, हर को हाँ मत कहिए, उससे आप भी ड्रेन होंगे, आपकी एनर्जी भी ड्रेन होगी। हर को हम खुशी नहीं रख सकते, हर को खुश नहीं रख सकते हैं। इसके लिए हमको कुछ लोगों को अगर दुखी करना पड़े तो भी चलेगा, लेकिन हम अपने आप को पहले से थोड़ा सेल्फिश होना बहुत जरूरी है। अगर सेल्फिश थोड़े से भी नहीं होंगे हम, तो दुनिया हमको वापस लेगी। इसके लिए अंडरस्टैंड योर प्रायोरिटीज। पहले अपनी फैमिली, पहले सेल्फ, फिर फैमिली, फिर अपना सोसाइटी। ऐसा नहीं कि दूसरों के हेल्थ के चक्कर में हम अपना हेल्थ हेल्थ लॉस कर रहे हैं, वो नहीं होना चाहिए। डू नॉट ओवर एग्जर्ट, रिलैक्स होकर काम करें। दो पैसा कम कमाए, लेकिन अपनी मेंटल स्ट्रेस कहीं होना चाहिए, क्योंकि बाद में जब स्ट्रेस बढ़ जाता है तो पेशेंट क्या बोलते हैं, आप डॉक्टर साहब आप कुछ भी करो, बस मुझे सुकून चाहिए, सब छोड़ छाड़ के मुझे सुकून चाहिए। इसके लिए अपना हेल्थ सबसे इंपॉर्टेंट है, डोंट एवर एग्जर्ट। एंड वेरी इंपॉर्टेंट, यू मस्ट हैव ए गुड सपोर्ट सिस्टम। ऐसा सपोर्ट सिस्टम जो कि 2 बजे भी आप फोन करें किसी फ्रेंड को तो बोले, बोल क्या हुआ तुझे, अभी क्यों फोन किया, हाँ बोल 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 बोल, चल सॉरी। तो ये ऐसे दोस्त होना बहुत जरूरी है। आजकल क्या हो रहा है, सब व्हाट्सएप फ्रेंड्स है, फेसबुक के फ्रेंड्स है, रियल फ्रेंड्स है ही नहीं। इसके लिए हमको रियल फ्रेंड्स, जो कहते हैं ना कि चड्डी वाले दोस्त, वैसे जिसको जिसको हम कुछ भी बता सके और वो हमको सिंपथाइज करे, ऐसे दोस्त होना जरूरी है। टेक ए ब्रेक बिफोर इट ब्रेक्स। काम का प्रेशर ज्यादा है, स्ट्रेस बर्दाश्त नहीं हो रहा, फैटिग हो गया, बर्नआउट हो गया, तो हमको ब्रेक लेना जरूरी है। टेक ए ब्रेक बिफोर इट ब्रेक्स। अगर ब्रेक नहीं लेंगे तो हम आगे बढ़ नहीं पाएंगे। और ब्रेक लेके काम करने से हमारा जो फैटिग है, जो स्ट्रेस है, जो बर्नआउट है, वो कम हो जाता है। शेड्यूल ऐसा होना चाहिए हमारा कि जो हमारे हेल्थ को सूट करे। अभी प्रैक्टिस में या ओटी में आपको लेट खाना हो रहा, लेट सोना हो रहा, ये चीजें अवॉइड करें। लॉन्ग रन में ये हमारे हेल्थ को नुकसान पहुंचाएंगे। इफेक्टिव टाइम मैनेजमेंट। टाइम इज मनी एंड योर इल हेल्थ इज सम अदर वेल। इसके लिए हमको टाइम का खूब मैनेज करना है। अपने टाइम को हमको अपना समझ के, किसी और का नहीं समझ के उसको मैनेज करना है। इफेक्टिव टाइम मैनेजमेंट विल रिड्यूस स्ट्रेस। और दूसरी बात ये कि जब भी आपको लगे कि मुझे हेल्प की जरूरत है, नेवर हेजिटेट। आफ्टर यू आर ह्यूमन बीइंग, ह्यूमन बीइंग कैन ब्रेक डाउन। तो कभी मेंटल फ्रैक्चर हो या कभी कुछ भी हो, माइंड डिस्टर्ब हो, तो आप बात करें जिससे क्लोज। अभी बहुत से लोग बोलते हैं बात करेंगे तो मेरी बात फैल जाएगी, लोग नाम खराब करेंगे। ये मत सोचिए, अपने क्लोज फ्रेंड से, अपने क्लोज ट्रस्टीज से आप बात कीजिए, मन को हल्का कीजिए। अगर टाइमली हेल्प लेंगे तो इट विल प्रिवेंट बर्न आउट। अदर थिंग इज प्रायोरिटाइज स्लीप। 6 से 8 घंटे की नींद होना बहुत जरूरी है। अगर नींद में कमी रहेगी तो हमारे वर्क को अफेक्ट करेगी। फिजिकल एक्टिविटी बहुत जरूरी है, सर ने बताया। हमारा कुछ भी मेडिटेशन, योगा या फिर वॉकिंग, साइकिलिंग, स्किपिंग, कुछ एक्सरसाइज हमारा जरूरी है। दिन भर के 24 घंटे में हमारे कम से कम हाफ एन आवर टू 45 मिनट्स हमारे पर्सनल हेल्थ के लिए होना बहुत जरूरी है। और जैसे सर ने बताया, माइंडफुलनेस, अभी में रहना, करंट में रहना, और मेडिटेशन improves our well-being. Healthy eating habits क्या खाना और कब खाना और कैसे खाना, चबा चबा के खाना, धीरे धीरे खाना, और टाइम पर खाना, ये बहुत इंपॉर्टेंट है। मेक टाइम फॉर हॉबीज। अपने जो हॉबीज हैं, राइटिंग है, शायरी है, पोएट्री है, रीडिंग है, मिक्सिंग विद फ्रेंड्स है, आउटिंग है, ये हम करना जरूरी है। अपने आप को काम का सिर्फ नहीं बनाना, बल्कि काम को अपना बनाना। बिकॉज हॉबीज टीच अस हाउ टू बी रिलैक्स, लर्न टू से नो, सराउंड योरसेल्फ विद पॉजिटिव पीपल। जो लोग आपको मोटिवेट करते हैं उनके साथ रहिए, ऐसे लोग जो आपको डिमोटिवेट करते हैं उनका साथ छोड़ दीजिए। दूसरी बात यह कि आपका मेंटर होना जरूरी है। कोई तो सीनियर हो जो आपको सपोर्ट करे, हमेशा आपको हेल्प करे, आपके डिसीजंस को लेने में मदद करे, आपकी परेशानियों को सॉल्व करे, ऐसा मेंटर होना बहुत जरूरी है। एंड नेवर हेजिटेट टू टेक हेल्प ऑफ ए कलीग। जूनियर से भी सीखना चाहिए हमको, कलीग से भी सीखना चाहिए, और सीनियर से भी सीखना चाहिए। डॉक्टर की डेथ कब होती है? जब उसका सीखना बंद होता है। ऑलवेज कीप रीडिंग, ऑलवेज टेक हेल्प ऑफ जर्नल्स, जर्नल क्लब्स, अटेंडिंग सेमिनार। सीखने का कोई लिमिट नहीं है, जितना हम सीखेंगे उतना हमारे लिए अच्छा है। लर्निंग, अनलर्निंग एंड रीलर्निंग, these three are very important in medical profession. And one more thing, before you take a drink to ease off, think of a shrink. अगर आपको लग रहा है कि आपके ड्रिंक्स बढ़ रहे हैं, या आप ड्रिंक की तरफ जा रहे हैं, या फिर ड्रिंक्स का अमाउंट बढ़ते जा रहा है, तो टेक द हेल्प ऑफ श्रिंक, बिकॉज दिस कैन कॉज हेल्थ इश्यूज। और क्राइसिस के टाइम में हमेशा दोस्तों के साथ रहें। वर्क इन पेयर, जैसे सर ने बताया, अपने आप को हमेशा अकेला मत, सेक्लूडेड मत रखिए, क्योंकि अकेला रह के, अकेले रहने वाला जो इंसान, वो हमेशा डिप्रेशन में चला जाता है। यू कैन नॉट प्रिवेंट रेन, परेशानियां आएंगी, मुसीबत आएंगी, लेकिन यू कैन यूज अम्ब्रेला। बिकॉज अम्ब्रेला रहेगा तो आपकी परेशानियां, आपका जो बारिश है, इससे आप बच सकते हो। ट्रस्टेड वंस को प्रॉब्लम बताना बहुत जरूरी है। आई इलनेस बिकम्स वी वेलनेस हो जाता है। दुख बांटने से कम होता है और सुख बांटने से बढ़ता है। फिर कभी टेंशन में सेल्फ मेडिकेट ना करें साइकेट्रिक दवाओं, बिकॉज दीज मेडिसिन कैन बी एडिक्टिव एंड दिस कैन हार्म यू। इसके लिए हमेशा साइकेट्रिस्ट फ्रेंड का हेल्प ले लीजिए। और ये हम पुलिस वाले जब डिप्रेशन में जाते हैं तो हम उनको बोलते हैं कीप अवे फ्रॉम फायर आर्म्स। वैसे जब आप डिप्रेशन में जाएं, या कुछ स्ट्रेस बढ़ जाए आपका, तो ऐसी कंडीशन पे ऐसी दवाइयां या इंजेक्शन जो हार्म करे, एनेस्थेटिक दवाइयां, वो आप थोड़ा दूर रखिए। किसी के साथ रहिए, अपने आप को अकेले मत रहिए। एंड लव योर ब्रांच। ब्रांच को कभी भी गाली ना दे, अरे मैं क्या और अच्छा ब्रांच मिल सकता था, नहीं। वाइफ को भी कभी गाली ना दे, और ब्रांच को भी कभी गाली ना दे, क्योंकि दिस इज द ओनली ब्रांच विच वर्क्स इन ऑल द थ्री प्लेन्स ऑफ माइंड, कॉन्शियस, सबकॉन्शियस एंड सेमी कॉन्शियस। थैंक यू वेरी मच।
थैंक यू सर फॉर द वंडरफुल टॉक। सर, हम
क्वेश्चन सर।
एनेस्थीसियोलॉजिस्ट हैं सर,
हाँ
और
हाँ
हमारी वर्क लाइफ बैलेंस बहुत ज्यादा इंपॉर्टेंट रहती है, या फिर बहुत ज्यादा डिस्टर्ब रहती है, ये कह सकते हैं।
जी जी जी,
द रीजन बीइंग वी हैव कॉल्स एट एनी गिवन टाइम, मींस रात को जब एक्सपेक्ट करें कि एकदम थक के आ चुके हैं आप, और
जी
कंटिन्यूअसली यू गेट अ कॉल एट इन द मिडनाइट 12 to 4 AM, कभी भी कॉल्स आ सकते हैं। तो वो सब चीजों से कैसे डील किया जाए, और अपना वर्क लाइफ बैलेंस कैसे मैनेज किया जाए सर? कैन यू एनलाइटन ऑन दैट?
सर, वी कैन मेक आवर प्रायोरिटी कि कितना काम करना है, कितना चाहिए मुझे, कितना फोकस करना है। बर्न आउट नहीं होना चाहिए। जितना आप कर सकते हैं, आपकी अगर 6 घंटे की नींद जरूरी है, उतना रखिए, है ना। तो दूसरी बात यह है कि आप टीम वर्क में कीजिए, ठीक है। इतने से देर मैं काम करूंगा, बाकी टाइम इमरजेंसी तुम देख लेना, तुम्हारे वर्क मैं कर लूंगा। अगर 2 दिन नींद नहीं हो तो अगले दिन नींद पूरी कर लीजिए। कंटिन्यूअस एग्जॉस्टेड होना नहीं चाहिए, एक बैलेंस होना जरूरी है। यू शुड पुट ए फुल स्टॉप एंड कम आउट योर वर्क। हर काम आप नहीं कर सकते, टीम वर्क जरूरी है। टीम वर्क में ही आसानी रहेगा।
टीम वर्क इज वेरी इंपॉर्टेंट, यस
वेरी
सर।
इंपॉर्टेंट।
बट सर, नाइट कॉल्स तो इनिशियल पार्ट ऑफ द प्रैक्टिस, जैसे कि स्टार्टिंग फर्स्ट 10 years 15 years ऑफ द प्रैक्टिस, इट्स वेरी इजी टू डू इट, बिकॉज वी आर ऑल्सो इन द एग्रेसिव मोड, दैट ओके वी
यस।
हैव टू डू इट, वी डोंट हैव एनी ऑप्शन। बट इन द सेकेंड फेज ऑफ लाइफ, मीन्स ऑलमोस्ट 40 45 years के बाद, ऐसे नाइट कॉल्स आते हैं, या फिर एकदम ऐसे इमरजेंसी कॉल्स आते हैं, तो उनसे कैसे डील किया जाए सर?
ऑलवेज कीप योर जूनियर्स विथ यू, जो कि इंथुजियास्टिक जैसे। ऑलवेज मेंटेन ए बैटन ऑफ डॉक्टर्स। आप टीच कीजिए दूसरों को, जो कि एग्रेसिवली आपके काम करें जब आप थोड़ा रिटायर हो जाएंगे। एंड ऑलवेज वी शुड रिटायर। हम लोग आजकल रिटायरमेंट ले नहीं रहे, इसके लिए हमको जब काम का फोकस कम हो रहा, थोड़ा जूनियर्स को आगे बढ़ाइए, उनको करने दीजिए, फिर आप थोड़ा रेस्ट ले लीजिए, फिर उनको आगे बढ़ेंगे तो फिर आपका बैटन भी आगे बढ़ेगा। इसके लिए टीम वर्क, अगेन आई विल टेल, टीम वर्क एंड डिवाइडेड वर्क इज वेरी इंपॉर्टेंट। इनिशियली आपको जोश ज्यादा रहेगा तो आप करेंगे, बाद में जोश कम होगा तो थोड़ा सा आप जूनियर्स को, सबऑर्डिनेट्स को टीच करके उनको आगे बढ़े।
यस सर।
और कोई सवाल?
जी, एनीवन हैज एनी क्वेश्चंस? मैडम, अमोला मैम, शिल्पा मैम, तेजवीर सर?
Can I, Dr. Yogendra?
यस मैम, प्लीज।
या सर, कुछ
madam.
कोरिलेशन है क्या ये डेली स्ट्रेस का और हमारे ओटी एनवायरनमेंट का? जैसे कुछ स्टडीज में कहा है कि ये इनहेलेशन एजेंट्स जो हम लेते हैं या ओटी में जो रोज का नॉइज है उसके डेसिबल्स ज्यादा रहते हैं, या फिर जो रेडिएशन हम लेते हैं ऑर्थोलॉजी, ऑर्थोपेडिक एंड यूरोलॉजी केसेस में, तो उससे भी हमें हमारा मेंटल इरिटेशन होता है। तो ऐसे कुछ स्टडीज है क्या जो आप मतलब कुछ करना चाहिए हमें?
डेफिनेटली मैडम, बिकॉज लॉर्ड्स ऑन या फिर इरिटेशन या फिर ओटी एटमॉस्फेयर वो अफेक्ट करता है मेंटल हेल्थ को, डेफिनेटली कोलेबोरेशन तो है ही। तो उसके लिए हम थोड़ा टाइम आउटिंग, थोड़ा ग्राउंडेड होना, थोड़ा ऐसी चीजें एटमोसफेयर में रहना जहाँ पे हमको रिलैक्स मिले, आउटिंग ज्यादा लेना चाहिए आपको उसके।
सर, आप कह रहे हो कि वी शुड हैव रिलैक्स टाइम, वी शुड एबल टू रिफ्यूज, बट आई थिंक इन प्राइवेट प्रैक्टिस इनिशियल 15-20 years इट्स वेरी डिफिकल्ट टू से मैं नाइट कॉल नहीं जाऊंगा, अरे शाम को केस क्यों लिया, इट्स रियली डिफिकल्ट सो
Yes,
दैट।
madam, but sometimes we have to put a comma, sometimes we have to put a full stop for our own health. जब हेल्थ इश्यूज आएंगे तो उससे पहले हम उसको केयर करें ना।
पर वो
हेल्थ इश्यूज अगर
बर्नआउट,
आ रहे हैं,
हम बर्नआउट हो रहे हैं, ये कैसा
यस
पता
मैडम,
चले?
उसके 3 इंडिकेशंस हैं: काम में फोकस कम होना, इरिटेशन ज्यादा होना, और तीसरी बात फैटिक जल्दी हो जाना। ये तीनों चीजें अगर अगर आ रही हैं आपको तो समझो कि आप बर्न आउट की तरफ जा रहे हैं। इसके लिए बेटर है कि
थैंक यू सर।
ईयरली अपना एक साइकोलॉजिकल चेकअप भी जरूरी है। वी कैन अरेंज साइकोलॉजिकल चेकअप ऑफ एनेस्थेटिस्ट, इज वेरी इंपॉर्टेंट। जैसे बाकी प्रोफेशंस में होता है वैसे साइकोलॉजिकल चेकअप आपको करवाना चाहिए अगर आप बर्न आउट हो रहे हैं कि नहीं हो रहे, एवरी 6 मंथ, एवरी 1 ईयर,
या
वैसा
मेरे
भी
ख्याल
जरूरी।
से
हाँ,
लाइक बहुत सारे प्रोफेशंस में, या मरीन पीपल है या
पायलट्स वगैरह।
कॉरपोरेट पीपल है, या
हाँ,
उनमें साल
हाँ,
में एक बार चेकअप होता है, सो मे बी वी एनेस्थेसियोलॉजिस्ट आल्सो
we should also,
a
because they are
psychologist
constantly
checkup.
under stress. हाँ,
Sir, what are the symptoms an anesthesiologist should seek counseling?
यस, अगर हम फोकस नहीं कर पा रहे काम में, गलतियां ज्यादा हो रही हैं, इरिटेशन ज्यादा हो रहा, सर्जन पे ज्यादा गुस्सा आ रहा, तो या फिर फैमिली लाइफ डिस्टर्ब हो रही है हमारी काम के एटमोसफेयर की वजह से, जैसे लेट शेड्यूल हुआ, लेट शेड्यूल उसके बाद भी घर पे टाइम नहीं दे पा रहे, उसकी वजह से जो है घर में डिस्टर्बेंस हो रहा है, तो ये चीजें हमें बताती है कि हमको हेल्प लेना जरूरी है और ब्रेक लेना जरूरी है।
तो जब थर्ड ईयर में हम साइकियाट्री पढ़ रहे थे तो मोस्ट ऑफ द थिंग्स व्हाटएवर वी यूज्ड टू रीड वर मींस वी हैड मोस्ट ऑफ द सिम्टम्स, अरे ये तो अपने को है, ये तो अपने को है। सो व्हाट इज द रियल थिंग इन विच वी शुड रियली सीक साइकोलॉजिकल हेल्प, सर?
See, if your problems are causing impairment in your social, psychological function, आपका काम में रुकावट आ रही है, परेशानी हो रही है, then you should, थोड़े बहुत सिम्टम्स तो सबके हैं, लेकिन ट्रीटमेंट उस टाइम लेना जरूरी है काउंसलर से या साइकेट्रिस्ट से जब वो प्रॉब्लम्स आपकी लाइफ को इम्पेयर कर रही है, उससे आपको लग रहा है कि अभी मुझे आगे बढ़ सकता था, बढ़ नहीं पा रहा, तो समझो कि आपको हेल्प लेना जरूरी है। क्वालिटी ऑफ लाइफ गेट्स इम्प्रूव, देन यू हैव टू टेक इट।
ओके, मोला मैम, एनी क्वेश्चंस? मैम म्यूट है आप। हाँ,
Yeah. I think what sir said, okay, you should learn to say no. That is
यस,
very important.
यस,
At the end of the day, you are tired, and at 6 o'clock you get or 8 o'clock you get a call for section. No, say no. There are 5 people on the panel. Every nursing home has 5 anesthetists on the panel. So if you are not available, they will call somebody else. Don't they do that for the morning calls? If you are busy in some call, don't they call somebody else? So learn to say no. Know yourself and your limitations. You are tired today, say no. I'm sure they understand. Everybody understands. It is in our fear, it is our insecurity and fear which makes us, run for a call.
Yes.
कि नहीं नहीं, मैं अगर ना बोलूंगी तो और किसी को बुला लेगा. अरे बुलाने दो. If you are good at your work, they will call you tomorrow. I
Definitely.
think that confidence is what you need to develop, and you should learn to say no. I agree with you, sir. That is a very important statement to prevent burnout, to prevent mistakes in your work, and to look after your health. I think that is a very important point.
Definitely. Definitely.
Yes,
Yes, sir.
ma'am. Agreed.
Thank you. Thank you.
Insecurity is one of the most
Yeah,
important things I
I
have to
think
come
people
across
have a lot of
in daily practice.
insecurity. I always tell everybody, दाने दाने पे लिखा है एनेस्थेटिस्ट का नाम. Don't feel insecure. आपके नसीब में है, आने वाला ही है. I always say that. दाने दाने पे लिखा है एनेस्थेटिस्ट का नाम. So don't think के अरे तुमने ना बोल दिया. If you have said no, but वो घूम फिर के आपके नसीब में है तो आपको ही आएगा वो कॉल.
Definitely.
सब 5 जन को पूछ के वो आपको ही फोन करेंगे कि अरे भाई फ्री है क्या, आ जाना, चल ये टाइम पे आ जा, वो टाइम पे आ जा. सो डोंट फील इनसिक्योर. लर्न टू से नो इफ यू आर टायर्ड. It is better to say no, lose a caller, than to make mistakes and lose your practice. This is my attitude to practice,
Definitely.
and I feel it. I feel what sir has said, कि learn to say no is a very important statement.
Yes, ma'am. Long-term investment.
Yes, long term investment. Don't feel insecure.
Yes,
पूरी
ma'am.
जिंदगी है एनेस्थीसिया काम करने के लिए.
Yes, ma'am.
So no need to burn out.
Yes. Thank you, sir. Thank you for the wonderful talk, and thanks for answering all the questions. And any closing words, sir? कुछ आखिरी शेर शायरी?
तो कहते हैं ना कि हम तो निकले थे अकेले, जाने पे मंजिल लोग मिलते गए, कारवां बनता गया. तो मेक ए कारवां, ऑलवेज हैव ए टीम एफर्ट, ग्रुप प्रैक्टिस. और हमारा हॉस्पिटल है विरार में, निवास हॉस्पिटल. हम लोग 4-5 लोग मिलके चलाते हैं और मिलके कॉल्स अटेंड करते हैं, ओपीडी मैनेज करते हैं, आईपीडी मैनेज करते हैं, और एक शेयर्ड इनकम है. एवरीवन इज सेटिस्फाइड. तो ग्रुप प्रैक्टिस इज वेरी इंपॉर्टेंट आज के दौर में. और अकेले सब काम नहीं कर सकते हैं. पेशेंट को लगे कि नहीं इनके पास बैकअप है, तो वो हम पेशेंट को फीलिंग दे रहे हैं.
Yes, ma'am, sir. Thank you, sir. Thank you very much.
Thank you.
After this wonderful talk by Shakib Danish, sir, we now invite Kajal Sharma madam for her talk. Ma'am, you can start sharing your screen. Ma'am is a clinical psychologist and she has over 10 years of practice. She has a master's degree in clinical psychology. She is attached to various schools and rehabilitation centers. She is highly skilled in cognitive and behavioral therapy. She is a life member of Indian Association of Clinical Psychology, and she is a clinical psychologist in Galaxy Hospital and Children Hospital. Over to you, ma'am. Ma'am, you can start sharing your screen. Ma'am, mute में आप.
Hello, everyone.
Yes, ma'am. You're audible. Screen.
Okay. 1 second, sir. Yeah, just give me a minute.
Yes.
There's some technical thing. Just give me 1 second, sir. Yes. So, are you able to view my screen?
Yes, ma'am. Screen is visible. Can you make it full screen?
It is full screen.
Okay. No worries. Fine. It's good.
Okay, sir. Okay. So, first of all, thank you so much for giving me this wonderful opportunity to speak and share some insight on the topic mental health and well-being. And thank you, Rao sir, for giving me this wonderful opportunity. Starting with mental health, I think we've all heard about the tips, techniques, and many important things. But I think I would want to start with a short activity for all of us. So maybe we can just have a look over here. What I would want to suggest is if you could give 2 minutes of your time to find out and rate yourself as to how are you feeling today. Okay, so would you want to tell and analyze and find out, are you feeling overwhelmed? Are you feeling okay? Are you feeling anxious? Are you feeling sad? Are you feeling frustrated? Let's take a minute and think about ourselves. What is it and what is really been affecting me as an individual? I am not wanting to target or want you to um, talk about how are you feeling in like at this point of time, but maybe whole of this week, how have you been feeling? Let's take it up that way. So let's take a like 30 seconds to reflect upon, and then I will share my screen again. With that thought, I would like to continue the presentation in here, starting with what mental health is. Mental health encompasses emotional and psychological and social well-being, influences how we think, feel, and act. It affects how we handle stress related to others and make choices, making a vital aspect of a fulfilled life. Now, what are the important factors that we see can be impacting all of our mental health? Would be the biological factors when we talk about the genetics, the brain, the chemistry, the hormonal imbalances, sometimes the life experiences. Sometimes we see people go through trauma, abuse, major life challenges, or any loss, social environmental factors that can affect our mental health and well-being, the lifestyle, the choices, the disturbances in the sleep, change in appetite. Sometimes the work stress is so much that we forget to take care of ourselves, which can somewhere damage and rupture our mental health and well-being. Going further, what are the other concerns? Reasons of distress that we see, family issues. We have our family children going to school to for any kind of uh, say job pressure or financial problems, health issues, trauma, developmental changes. These are the certain factors where we do affect and we do see mental health and challenges going through across the people around. Reasons and signs of mental health issues could be the signs of distress that we see now. Many a times we don't really sit back and think what is going on. All what we do is, yeah, I think I have fever and I need to stop and just take up something. But have we even thought of what other things are actually going on to our mind? What really happens to my thought? Am I thinking rational? Am I thinking somewhere where my feelings and my thoughts are in line? So let's think about other signs and distress which goes on. So very important is the cognitive symptoms, difficulty in concentrating. I just can't concentrate with my work. There's a lot of things, a lot of the work already there. Negative thoughts about self-harm or any kind of any suicidal ideations. Further, we go about other sign of distress could be emotional symptoms where there is persistent sadness, feeling anxious, then mood swings or shame, guilt, hopelessness. These are certain emotional symptoms which person with mental health concerns may see a sign as distress, sign of distress. We can also highlight more on physical symptoms. What is it, the physical symptom that we see? It's unexplained aches, pain, fatigue, थका हुआ हूँ, मुझे कुछ काम नहीं हो रहा, I don't know, I can't take it, I just need a break. This is like constant thing which goes on to us ourselves, and then we feel tired for no reason. We don't know what's happening. Change in appetite. आपके सामने खाना है, but I don't want to eat, I don't want to drink, I need a break. So these are certain things which just goes on in a person who has been concerning with their mental health issues. Behavioral symptoms, substance abuse. Many a times we think that it is okay to just pick up a peg and just have, you go on drinking, there is no limit to what you're drinking because you want to enjoy. But is it enjoying or is it like you are stressfully having or consuming some of the substances or social withdrawal? You may not want to connect with your friends, family. Okay, I've just got back from work. I don't want to talk to anybody. I need my own space. But even when you are in your own space, are you like really giving that time, productive time for yourself is a sign is a question mark in here. Changes in daily activity, the activities that a person would do regularly, are there any shifts in there? Let's just think about it as well. Aggression, self destruction, in case अगर घर में कोई कुछ आपसे बात करे तो आप अचानक से गुस्सा हो जाएगा, आप काफी रिएक्टिव हो जाएंगे. Or there are further other risk-taking behaviors which does get involved. Recognizing early warning signs, very important for all of us to identify and check that there are certain signs which are very common across all the age groups. Let me talk about persistent sadness or anxiety. Should you be talking about social withdrawal, then changes appetite, change in sleep, anger, irritability. These symptoms and these signs are very common across most of the age group that we feel and we see. Now, if I will have to talk about impact and the daily functioning, how has this been impacting? It affects our daily life, our performance life. If you are not thinking rational, if you're not feeling okay, should you be going for an immediate and an important work? The question is sit back, think, reflect, and then take an action. So should we actually do? Should we not? Should we do? So these are the questions that goes on. But I think that particular time, let's just hold on and identify what is really important at that particular time. Then because this can affect your daily life, it can also affect your work performance and the impact of relationship. Relationships doesn't mean only the family, but it also means your workplace relationship. How can your mental health affect the culture in the work atmosphere as well? And in case these symptoms goes on, or in case there's a constant worry, constant irritation, constant questions or constant self-doubts or any kind of self-harm, is that a sign that I may need some professional help to deal with this symptoms or these signs that I'm going through? Some of the common psychological disorders that we are all aware, but just highlighting more to do with adults, which we talk about depression, anxiety disorder, bipolar disorder, schizophrenia, PTSD, OCD, substance use. When we also see we have children where they go through with a lot of ADHD symptoms, there is anxiety disorder, there is depression, autism, there is a rising rate of lot of learning disability issues with children where sometimes they don't receive that immediate care and attention right at the early years. And that's where children develop a lot of learning needs. There are other concerns which need to be taken care. So while you are working on yourself, it is essential to look around. Should there be any other person or anybody whom will equally require that help and support? Now, the key indicators for seeking support. The very important factor is importance of early intervention. We always think that, yeah, abhi nahi, baad mein. We keep on procrastinating. I think there is a time where we've all procrastinated or we still do. In fact, it even comes to me. Sometimes I may want to prioritize sometimes, but I may not want to also. On the other hand, so all what I would do is, no, I will deal with it later. But what happens is, if there is any mental health concerns which you are struggling with, or it has been really of concern, it is essential to seek timely support then just delaying it or buying time, because you are important not only for just for your well-being or for your particular work, but for everybody around. You are very important as a person. Then prevention for the progression, the better earlier that you get yourself checked by a professional, it is always better that you get timely advices and you are able to deal with it. And somewhere who says that it is not okay, it is absolutely okay to seek help. And it has been really great where people talk about mental health so openly. Today we started up with this beautiful session by Dr. Harish Shetty. We had more expert doctors where they shared that how normal mental health and the awareness has been spreading across the globe. So I think sharing your views and sharing your thoughts and your ideas with someone that you love or anybody, your loved ones or your friends. But sometimes if you think that you may need to speak to any professional, then without any hesitation, it is always advisable to reach out to one. Now, the question arises, okay, fine, what about it? Now, when do I seek help? What is it that, what are the areas? So then we can focus on persistent symptoms. If you see the symptoms have been continuously going on, which means that the symptoms last for prolonged period, or there is any risk or harm, if there is a thought of self-harm or harming others, interfering with daily life activity, when symptoms significantly disrupt daily activities, seeking help is crucial for recovery. Professional evaluation can provide essential support and interventions tailored individual needs. Indicators for seeking professional helps. Now, severe symptoms, when symptoms are severe, it is often a sign for seeking professional help. Prolonged distress, prolonged symptoms that lead to distress are crucial indicators for seeking professional help, assistance to prevent further impairment. Like I already mentioned, the early intervention is a key to for a better prognosis and for us to identify how can we reach out and get correct help for our mental health and well-being. There has been a lot of stigma, and also somewhere people are not very comfortable talking about their mental health even today. So but there are many other ways where you can share this information with a therapist or a psychiatrist or your doctor, that how confidential you may want to keep this. And of course, these things go very confidential when you are discussing your own emotional concerns. So it is okay, rather sitting and dealing and thinking about and taking up any more burden and pressure, it is always advisable to seek help and get some more clarity onto your thoughts in helping you generate more rational thoughts to help you live a better life. So types of professionals that are involved in therapists and counselors, types of therapy. There are therapists, there are counselors that provide various therapies such as cognitive behavior therapy, psychotherapy, family therapy. There are mental health support. These professionals assist individual addressing their mental health issues affecting through talk therapies. Benefits of therapy. Therapy can lead to an improved mental well-being and better quality life. It helps you being more resilient, coping. It helps you develop some coping mechanisms which will ensure you live a better life. Now, many a times we ponder, okay, now should we go to a psychiatrist, psychologist? Let me highlight what is the role of a psychiatrist. Psychiatrists are medical doctors who prescribe medications to treat mental health disorders alongside providing therapy, while psychologists primarily focus on providing therapy and conducting psychological assessments to aid mental health care. Importance of both the role. Both psychiatrists and psychologists plays a vital role in mental health, addressing different aspects. Psychiatrists and psychologists do work in line to help you deal with your concerns better. So it is essential to seek certain help whenever there is a need. Support groups and community resources. Connection to support group. Support groups create a safe environment where individuals can connect and share their experiences with others facing similar challenges. Community resources. Community resources include organizations and programs that offer support, education, and assistance to individuals in need. Lastly, mental health organizations. Local mental health organization can provide a wider resource and support to individuals seeking help and guidance in their mental health journey. Conclusion to end up here is recognizing symptom is the most important, yet it could be slightly difficult because we may not want to, we may not sometimes know what is going on with us. तो सबसे पहली बात है हमें जानना कि एग्जैक्टली हम क्या महसूस कर रहे हैं, हमारा थॉट्स क्या है, व्हाट इज इट दैट रियली बॉदरिंग मी. Then understanding the symptoms are the first step. Next, we talk about the available resource. Now that we know that there are lot of help and support which is available for all of us, why stop and why not just go and seek help? Should there be much more clarity and a support? Lastly, open communication. It is very essential to have a very open communication with, first thing is with yourself. Many a times what we do, we are so busy and involved in our regular activity and our work, sometimes it is our family, that we forget there is something that is called I. So we need to sit back, think, reflect, and ensure that we are firstly there for ourselves. Maybe you do not have time to reach out to a person, or you don't have time to discuss about your mental health and well-being. Maybe at that time, sit back, start journaling. You can write in your own thoughts. There are many times where you can just keep a blank paper with you and just take a marker, pick a pen and just start doodling. Just doodle. Sometimes listen to a soft music at times. These certain simple techniques help you get more clarity and somewhere calm you down. It gives you direction because you are giving time to yourself. So mental health is very important, just as your physical health. So let's go ahead. In case should there be any other uh, views or insights by anyone, please we can share, or any questions if you have, then let's just talk about it. Thank you, sir.
Thank you, ma'am. Thank you for
Yeah.
the wonderful, crisp, and precise talk. Hope it has benefited a lot of us. And one question, ma'am. There was a slide on when do you visit a psychologist and a psychiatrist? Can you elaborate a bit more on that? When do we need to seek professional help from a psychiatrist, and when should we seek counseling from a psychologist?
So, sir, sure, I'll do that. So, what happens is many a times you, depending upon the severity and for your symptoms, it is essential for you, if you are wanting to seek a, having, like sir mentioned, that having a pill is, there is no harm in mentioning in having a small pill, and in case you want to function better with. So, I think visiting a psychiatrist is always advisable. Yes, you can. But in case you are wanting to get in for any kind of talk therapy or certain counseling where you may want to sit back and work on your say symptoms and concerns with regard to psychotherapy, I think essential is to for you to decide what is the severity of your concern. Is it like somewhere you do think that basis on your concern, yes, you can visit a psychologist and deal your concerns, well, you can help yourself deal with it, or I think it's very difficult for me to even tell you that, yeah, you can just go to this person or go to that person. I think sit back, think, and analyze what is really essential. How severe is your concern? And along with that, you can take a call then.
Supposingly, if a person is suffering from some depression or something, so first thing to do is visit a psychologist or a psychiatrist. How do you go about it?
So again, people do visit a psychiatrist at very first, but in case, and psychiatrists are equally good enough when it comes to counseling and medications. Somewhere psychiatrists and psychologists work in collaboration. So it is not like you should go to a psychiatrist or you should do a psychologist. It is somewhere the better thing is reach out to a professional, either a psychiatrist, allow your doctor or your therapist to decide what is really better for you. Sometimes you may want to visit to a psychologist first, but in case there are certain symptoms and there are certain measures where you, certain things where a psychologist think that that a patient may require a medical help, then the psychologist will want to recommend and seek opinion and guidance from a psychiatrist, and would want to refer a patient to a psychiatrist for a medical help, because psychologists are not trained and not really one who would help with medications. We are somewhere helping you with deal with certain counseling skills and psychotherapy.
Okay. Man, of late, post-COVID, there are very high incidences of the kids having some or the other psychological issues or of some form or the other. How is it recommended for the kids to be visiting some counseling session?
So these days, we see that many schools, every like children going to school, they have in-house counselors, they have in-house support that can help identify should there be any concern observing in the where they have observed in school. Let's find out that whether the child is facing any difficulty at school level or where they're going for the class. First thing is to identification, what is the concern that the child is facing, and thereafter how to go about it. I think it for working with children, you have to go through the school, then you have to meet the parents, you will have to meet the classes that he is going to, ensuring that the child receives get a holistic understanding about the child's well-being, then helping the child cope up there are with the concern that is going through. Many important parents do play a very significant role. We have so much of time for our work, but sometimes what happens is it's easy to just give a phone to the child. Okay, fine, just keep the phone, and I'm a little busy. Is it really nice that we are doing somewhere? I don't blame parent. Every parent would do that, but there are many times that you may want to do it. Sometimes we as adults get responsible for increasing the screen time. So children have a lack of communication. I think communication is the key. Children require a lot of play. They require a lot of communication where help them ease out, express, and learn better with communication and building strong relations. So early identification, finding out what are the stressors in school, how is the child performing academically, socially, emotionally. I think a lot of observation from parent is essential.
I'm talking about mobile. So the mobile is something which has caused issues in adults and children as well. Now the games that are being developed, they are causing so much dependence on in the kids that they start becoming rebellious. So how do you deal with it, or what needs to be done if the child is having a mobile phone, they are on the games, or if they are seeing the TV also, they are doing some gaming or something. And the games nowadays are designed in such a way that they are becoming psychologically dependent on that. You know, so how to go about it and what can be done for that?
So I think there is always a reason why a child does a particular behavior. A child will never want to pick up a phone and play on his phone for hours if there is somebody to talk and express with him. What we sometimes as adults may just not pay a light into. There are signs where a child does say that I want to express, I am not really okay with a few things, or probably he is not occupied with certain play or certain activity that he can. So the easiest thing is that yes, I'll pick up a game and I'll start playing. Somewhere sitting back with your child, and it is important even for us to find out and tell, okay, fine, you're playing something, let me see what is it. So somewhere being more involved with your child and understanding his side of world and setting up certain boundaries and certain timing. I think it's very nice that where many people do set boundaries and certain timelines for the usage of the screen time. Yes, sometimes children don't listen, but again, we as parents have our own tricks and techniques to deal with it. In case you still think there is something, then yes, seek help of counselors and therapists where they can help you start, plan a structured timing for the child, make a schedule for them, ensure that even um you get to know what are they doing, what games are they doing. So make sure that you are very mindful and not really very harsh when the child is playing for very long. Understand why is he doing that. Let's go back to whys, because many times what happened, we do not really focus on the why, and we just at our reactions are such that makes the child feel very irritated and aggressive, and they want to do the would want to repeat the same behavior again and again. So let's just go on to the whys, understand why is the child doing this, and then just go on identifying this.
And now to this group gaming as well, you know. What
Yes, yes.
happens, my son has his laptop, he starts playing game on the laptop, and on the phone he's talking to his friend and they are playing games together. Now there's group gaming that is going on. So that is also an issue, how to deal with it.
So again I think when it is group gaming as well, I would again want to go, why is he doing that? Why is he that? Has he been exposed to the group that he can really play around? Does he, or probably using that technology as a skill to help him learn something out of it, or somewhere sitting with your child and being a part of, I'm not saying start playing with him, but understand why we are doing it. Again, setting up boundaries and timelines. And I think every child listens to us when we are very clear and very firm and a very equally polite when we are approaching and talking and helping them set boundaries for them. Yes, tell them what is right, what is wrong, how can this be helpful, how can this not be helpful. Every person loves to be encouraged and to be feel motivated. Like yes, there are many children in my family who are still more addicted, but what I do is I sit back and find out what is the game that the person that the child is playing, and how can this be helpful, what is it that I can do differently while helping him to get away from the screen time. So I think a lot of talk is required and a conversation is required. A lot of time spending is required with your children to help them curb the addiction and the dependency of a screen time and phones.
Okay, now coming to adults, ma'am. Now there are reels. Reels. Once you start scrolling the reels, and it goes 1 p.m., 1 a.m., 2 a.m., 3 a.m. Morning में 6 बजे का call भी जाने का है. How to overcome that now?
So again, we adults lack the human touch, and somewhere we don't know how to disconnect and connect to ourselves. So I think we take screen time as one of the factors where we disconnect with the world and we connect with our screens so much. So how to deal it is again by setting a strict and very firm boundary that I'm not going to be wanting to touch my phone beyond a certain time. Sometimes we cheat our own mind. We promise something and we don't stick to it. So that certainly means that, yes, I am not sure about what am I doing and what am I really getting out of it. So sit, think, and reflect that what are you doing. Rather, it is essential that you start your day with planning your day well in the morning as you wake up, like a to-do list for, like when we started to work, we always, the first job and the first day, we always have a to-do list. I'm going to do 1, 2, 3, 4 things. But I think this needs to be a practice by all the adults on a daily basis where and you're mentioning that, yes, by this hour, I will be doing this. And if you are succeeding in the first go, I think you must treat yourself with something of your own favorite choice. Somewhere this is growing, this issue, and has been going with everyone. Seek time where you are sitting with your family. Make sure you make a routine for yourself so that your dependency of this thing is not so much. Also, maybe apart from doing, browsing your phone, there are a lot of other techniques that you can be yourself involved, and it can even help you, like journaling, where you can just write down, like I mentioned even like a couple of minutes back, just write down your thoughts, or maybe give time to yourself, prioritize your time for yourself, and limit your interactions with the virtual world. Maybe that is going to be helpful. Setting boundaries, let's do that. It will be difficult, but we can talk about it. To add up one more thing, many times people do this for various other reasons. Uh, So I think when you get a chance to talk about this in length with your therapist, I think you must do that as to why are you doing it. I would want to help a person understand as to why is certain behavior of yours. So I think even with adults, it goes for the same. Let's focus on why.
Ma'am, what is the solution of continuous stress daily, day-to-day life? Should there be any help that should be seek, or one can help themselves by any technique or any therapy?
Fantastic question. So I
That is
think
by Shilpa, ma'am. This question is by Shilpa, ma'am, technically.
Okay, ma'am. So I think stress has been an ongoing phenomenon for all of us, ma'am. And I think what the amount of sometimes we fill our plate so much and we think that I will be able to manage with whole of it. Let's just be a bit more mindful. So when we talk about mindfulness, that's the first step. Whatever I'm taking in, how much is in my stride, I'll be doing that. Let's not just take up n number of things, because that's going to be making you feel much more stressed because you don't know how to manage yourself. Next is prioritizing and again categorizing your kind of work that you're doing. Like if I start my day morning at 6 or 6 to 9, this is the time 6 to 9 that I will be doing. I can't take up something. Again, we must be open to say no and be assertive on certain things which we cannot do, because till you don't prioritize your own mind and your own way of working, the level of stress is definitely going to increase. And what you can do if you are stressed, I think reaching out to your friends, to your family is the first thing that we all do. But sometimes you may want to not feel judged. I mean, you may not feel comfortable that, yeah, there are some other things which are going on. Then I think speaking to a colleague also help. But yes, you may further need some help. Then please, if you think that that stress is help, somewhere coming into your daily work life and helping you, not helping you rather with any other thing, then visiting a psychiatrist, psychologist is recommended to help you deal and help. They will help you formulate one structured timeline for yourself and how can you be much more balanced holistically.
Thank you, ma'am.
Thank
Thank
you,
you.
ma'am. Thanks a lot. Anyone, ma'am, Shilpa ma'am, Dorud sir, any questions? Ganesh sir.
Yeah, I had put one more question. Do this support group need to be registered with any government body?
So, ma'am, what happens is every support group like that, they are already registered and they are a part of a government bodies. But it totally depends. While there are like what I can do is I can connect with you in person and maybe you can share some more information on this. But yes, they need to be connected to a government body, which is there are private support groups as well. There are support groups available even virtually. So yes, but we do recommend people who are trained and licensed. They start up with a support group, so they are much more professionals dealing and helping people deal with their personal, social, emotional well-being.
Thank you.
Thank you.
Thank you.
Thank you, ma'am. Thank you for your elaborate session and thanks for answering all the questions.
Thank
It
you,
was
sir.
a pleasure watching you. Thank you.
Thank you, sir. Thank you.
Now, I would like to call upon Ajit Nerurkar, sir. Sir is a senior consulting psychiatrist. He's working from Malad to the Isar Borivali area. Sir is an honorary psychiatrist in Suvarna Hospital, Karuna Hospital, Bhaktivedanta Hospital, and Navneet Hospital. Welcome, Ajit, sir. Welcome to the Forum of Anesthesiologists.
Hello, good evening. Am I audible?
Yes, sir.
Acha, okay. Very nice. Anyway, at the outset, let me thank all the organizers for inviting me to address you all. It's a pleasure and honor. But at the same time, I need to apologize as well because I have not heard any of the previous sessions. So whatever was, except the last question that this young girl was taking. So whatever was discussed in the previous 2 hours, I'm absolutely unaware. So I just hope and pray that there is no repetition in whatever that I'm going to say to you. So after having said that, see, when I heard this topic for the first time, daily stress amongst anesthesiologists, two incidences which occurred around us in the last couple of months immediately came to my mind. One was regarding a college mate of mine, and obviously known to all of you, that he worked in a general hospital in spite of being in discomfort for when he finished his whole day's list and then traveled in spite of the discomfort, self-driven car, about 20 kilometers to a suburb in the Ville Parle and worked in his friend's nursing home for another 2 3 hours, a long case. And by that time, the problem had increased to such an extent that he had to be admitted and he passed away the same evening. The second incident which I can recollect was that about another anesthetist. He was on his morning routine. He was in a gym. And while doing his exercises, he noticed that another person was just lying on the floor, who turned out to be another doctor, orthopedic surgeon. And he immediately swung into action, realized that it was not yoga that was going on, but the person had arrested. So he gave some CPR and used a defibrillator, brought him out of the arrest, saw that the respiration and the pulse was back, and then shifted him to ICU. Both these incidences show us that anesthetists ignore self-care, as in the case of the first, and even leisure to be of service to society. you are always at the forefront of all emergency medicine. And emergency means stress. And all this work, to my mind, was largely unacknowledged. For example, if there is a heart transplant being done somewhere in the city of Bombay or wherever, the newspapers are going to flash the news about the surgery and the cardiac surgeon's name will be in huge letters. But the anesthetist who has worked with this person equally hard and for equal amount of time gets no mention. Recently, there was another neurosurgeon who removed a 3-inch knife from the back of a film star. Again, his name got flashed in the newspapers, all newspapers the next day, but the anesthetist was not mentioned. So all this behind the limelight work also must be raising some habits. So what exactly is stress? Stress is the body's reaction to a demand or a threat, often triggered by new, unexpected or out of control situations that may exceed the physical or mental capacity of an individual. And if it is not sudden and unexpected, if it is chronic, then it has to be recalcitrant, something that which cannot be removed. Before we go further, it would be important to ask a simple question. Is stress really a medical word? Psychiatrists diagnose anxiety, depression, schizophrenia, phobia, panic, OCDs. But do I ever use the word stress in any of my patients? And the answer, to be very practical, is no. So stress is actually layman's terminology. But then why do we use it so often? Even doctors use it. That is why today's seminar is stress in anesthesiology. Because it has become very popular. This common terminology, layman's terminology, has become so popular that it becomes impossible to ignore. There are various physical, emotional, and behavioral sequelae stress. I am assuming that most of those will be covered, must have been covered so far by the speakers who have talked before me. So I am not going to go into any of those. I am not going to be showing you any slides, no PowerPoint presentations, no take-home message either. I am just going to be having a heart-to-heart chat with all of you, and maybe perhaps try to instill a few ideas by tickling your minds. If you find them worthwhile, you can retain them. If you find them useless, you can throw them away. And all this is going to be out of my association with the various anesthetists that I have seen over the years. Whatever I have experienced in them, I will be relating to you. Now, the anesthetists that I work with, the only common procedure that we have in ECTs. So a large number of people I have worked with in anesthesia, I have worked with in psychiatry for ECT anesthesia. Then there are friends because of the medical profession that I know and have interacted with, but have not worked with them. Some anesthetists have come to me as patients. So even that group I am going to draw upon. And some have brought their relatives as patients to me. So without taking any names, all these four I will be drawing upon to lay certain conclusions about stress in anesthesiology. Now, this sort of a categorization is actually not adequate to emphasize what sort of a stress all of you people feel. So I am going to do a further classification based on the work location of anesthetists and the work patterns of anesthetists. The work location is very easy to understand. Either you are into a private hospital, or you are into a public hospital, or you are into private practice. I am imagining that the majority of you, whoever is present here, largely must be belonging to the third category, that you are all private practitioners. But various combinations are possible. You may be in public hospital with private practice, you may be in private hospital with private practice, or you may be in some occasions in all three places, public plus private practice. And the second type of classification that I intend to do is going to be based on work patterns. Now, the work patterns which I have noticed are the following. There are four types that I have identified amongst you. One is a jack of all trades. He's giving ECTs in the morning, then maybe he's in the ear for some tympanoplasty, then maybe he's in the eye for glaucoma, then maybe in the nose or the nose for rhinoplasty, the throat for something like tonsil, or maybe thyroid, or down in the abdomen for spleen or kidney, or maybe some gynec surgeries, hydrocele, hernias, piles, fissures, varicose veins. So you're all over the body. And that is how the anesthesia class has to be. You are everybody's friend. And majority of the anesthetics that I see are going to be belonging to this category. You have got multiple hues on your palette. If I were to borrow a kitchen-based analogy, just for the sake of humor, I would call it a mixed vegetable presentation, a mixed vegetable anesthesiologist, because you have got multiple operations on your plate. The things change every day, every hour. It may be ABC one day, it may be BCD the second, CDE the third, AB the fourth day. This keeps on changing, but you are changing the field of your activity on a day-to-day and hourly basis. The second kind of anesthetic that I have noticed during my tenure as a psychiatrist or a physician practicing in Bombay is that they are specialists. They will work only for one branch. One normally finds them in private hospitals. Supposing they are working in cardiology, then they will be into angiographies and angioplasties. They will be in coronary artery bypass surgeries. They will be in heart transplants, but they will not be working in any other branch. They will restrict themselves to cardiology and work with either a single person in a single hospital or with 2-3 surgeons of the same variety, so that they give a specialized outlook to their approach. Now, since they have got a single item on their plate, again borrowing a kitchen-based analogy, let us call them a chicken biryani kind of anesthetist. I want you to remember these monikers that I have created, because I will be using them repeatedly in the next 10 minutes of my talk. Can you expect a chicken biryani kind of anesthesiologist to maybe do a hydrocele or a hernia? The answer is no. It would be like expecting Amitabh Bachchan to act in a Girgaon Chowpatty, Ganesh Utsav, Natak Mandali production. These kind of condescensions don't naturally happen. They will stick to their branch. They will stick with a select few people. They will stick with maybe a single surgeon and a single branch. The third kind of anesthetist that I have seen is a clock watcher. The moment he enters the OT, maybe at 8 o'clock in the morning, he is going to announce that there is another case at 10 o'clock. And when he goes there, there is another at 1 o'clock. And there is another at maybe 4 o'clock. Not only is he increasing his own blood pressure by repeatedly referring to the clock, but he also keeps the surgeon on tenterhooks. And the fourth kind of anesthesiologist that I have noticed, and I would like to call them the road runner type, the traveler class. I have a friend of mine, a classmate, who has migrated to the US. Every day morning, he starts his day with a commute, 110-mile commute from his residence to a Chicago City Center hospital where he works. Now, covering 110 miles at the beginning of the day is maybe permissible in USA because the roads are very good there. But imagine such a eventuality in Bombay, staying in Bombay and maybe running to Pune. That would be a harrowing experience. Why Pune? Forget 110 kilometers, traveling even a distance like say coming from Mira Road to Goregaon along Western Express Highway or say SP Road. In all the traffic and the heat and the dust and the noise will be harrowing and stressful for any person. Having now classified the anesthetics, you can have in further classifications also, maybe an urban and a rural type of classification. But the broad categories, even in these places, rural or whatever, will be more or less the same. Either you are into private practice, public hospital, private hospitals, or you are into any of these four categories that I have mentioned. Now, before I go into highlighting the stresses that I have recognized in these people, let me talk something about the stress relief factors that any person is likely to have. And there are only four that I can enumerate. One is sleep, one is food, one is exercise, and the fourth is hobbies and activities. Now, I find, and I think you can either corroborate or maybe negate me, that anesthetists as a class cheat on all four levels. Sleep is always a problem. Sleep has got four cycles in a night of 7 to 8 hours. There is deep sleep, there is light sleep, there is REM sleep. Suppose you wake up maybe after 2 hours, then you are because REM sleep is the most refreshing part of anything. If you experience morning time sleep, then you are mostly into REM or dream sleep, which is necessary for giving you a sense of fulfillment, happiness, contentment. But if you sleep at 11 and wake up at 2 o'clock for a case, then the whole REM component is more or less cut out. So that reduces the happiness component. Sleep is extremely important. You have to find out how many of you cheat on sleep. Next is food. 4 hourly 4 meals is a standard thing: breakfast, lunch, tea time, dinner. I may perhaps concede that anesthesiologists may be having breakfast and dinner in a sumptuous proportion, but you are always deficient as far as lunch is concerned. Either it is postponed or completely cancelled or maybe replaced. A good roti sabji dal chawal get replaced by just tea and coffee or tea and sandwich, which is hardly adequate for sustenance and for a stress-free existence. Whenever you are hypoglycemic, what happens is that all the sympathomimetic substances get secreted into the system, and you are going to be having palpitations, tachycardia, breathlessness, sense of lightness in the head or fullness in the abdomen. And all these are the symptoms of a stressed existence, but they are also the same as that in a hypoglycemic person. So remaining hypoglycemic by not eating from time to time is akin to a stressful existence. The third thing is exercise. Some of you I have noticed may be doing some gymming, cycling, or swimming, but the majority are completely averse to exercise. And maybe I can extend this to most doctors because most of us sit in our clinics for something like 7 8 hours a day, sitting in a chair and seeing patients. You are in your OT sitting on a stool and watching the various monitors which have been put up there. But that is hardly exercise, it is professional work. Man is the only animal who gets his food without having to struggle for it. A monkey has to climb a tree before he gets a banana or a fruit. And a lion has to run behind a hare or a deer and achieve the kill before he can eat it. But whereas we just sit in our clinics, go home, and the food is laid out on the table. Exercise is going to utilize all those sympathomimetic amines which are going to be secreted because of whatever stressful experiences that you are having. And secondly, the exercise also secretes endorphins in your head, in the brain. So it is a two-way benefit that the sympathomimetic substances which are secreted because of the stress, they are all utilized. So the stress is gone and happiness quotient is increased because of the endorphins which are secreted in the brain. Both these things you are going to miss if you do not exercise. And the last thing is hobbies and activities. Hobbies and activities are an extremely important part of anybody's existence. You must have definitely heard of instincts. Eros, Thanatos. Eros and Thanatos are the pleasure and pain instincts which are necessary for our day-to-day existence. They can explain the first three factors: sleep, food, exercise. Yes, but what about the fourth instinct, which is as important and which adds color to your existence? That is the socialization instinct. The very this very seminar, this webinar that we are presently conducting is also a social experience. A social experience gives you a sense of belonging to some group. It gives protection, it gives care, it gives satisfaction. When you are in difficulties, you can fall back on that group. Hobbies and activities, whether it is reading, writing, talking, making friends, maybe on social media, maybe on Instagram or WhatsApp, or lifting up a phone and putting through a call, television, cinema, dramas, all this which is a part of the hobbies and activities component, it all comes under a socialization instinct. So you have to remember that just eating and sleeping is not important for happiness and a stress-free existence. Without socialization, there can be no color added to your life. Now, having said all this, the classifying anesthesiologists into two groups and maybe underline to a certain extent the necessary relief factors. Let us now go to understand how the two classifications that I have made about location and the pattern of work become applicable for your stress. Now you have to take this because I am saying this that I find public sector anesthesiologists as the least stressed group. The private hospital anesthesiologists come after that, and the private practicing anesthesiologists are the worst affected. So it would be important for us to first understand why this is so. Why is stress lesser in a public hospital as compared to a private practicing psychiatrist? And this can be understood on all the four things which I explained as stress relief factors. For a public hospital anesthetist, the traveling is going to be minimum. That person need not be a road runner. He has to only travel from his home to the hospital. But once he is in the hospital, he has to be in the OT for the next 7 to 8 hours. He may perhaps go from one room to the other room. But between any two procedures, there is not too much of traveling involved. The second factor is food. Food is always better organized because there are specific lunch hours in public hospitals. And these are important because it is not only for the doctors or operating, but there is nursing staff, there are cleaning staff, servants, etc., etc. So all these people have to be taken into account. So the lunch hours are managed and maintained to a much better extent in public hospitals than in private hospitals. The third is the type of work. Although a public hospital person, his uh, plate is going to be like that of a mixed vegetable type of anesthesiologist. It is going to be a mixed vegetable anesthesiologist with a difference. And the difference is that most of the anesthesiologists are placed in particular departments for a particular amount of time, maybe 1 week, 2 weeks, 3 weeks. They may be in general surgery, they may be in gynec. So they are working with the same kind of people in the same OT on similar procedures that generates a sense of comfort over a period of time, and a sense of comfort which is generated in these kind of places is a stress relieving thing. The fourth important thing is that all public hospital anesthesiologists, they are in a sort of a group practice. Supposing you are not well, then you did not toil away in spite of the discomfort with some social implication in your mind. You can definitely take some time off. You are replaceable. Somebody else can come in your place and meet the responsibilities of the day. So the pressure to work in spite of sicknesses, as was there in the first case which I mentioned about the anesthesia friend, will not be there in a public hospital setting. And the fifth is the emergency work. The emergency work in public hospital gets distributed. Supposing, let us say, a place something like KM or Nair, there are 4, 5, 6 units. So all of them are going to be distributed. If there are 3 units, let us say, for example, then each unit gets an emergency every third day. Every third Sunday will be an emergency for the anesthesia department. So what happens is that 2 days at least, you are absolutely certain that no emergency will be coming your way. Now remember one thing, anticipating an emergency is more stressful than actually waking up at 2 o'clock in the night and going for work. Anticipatory anxiety is the most stress inducing factor. Now that is taken care of in a group practice, which is there in public hospitals. Now, coming to private hospitals, it will all depend upon the size of that hospital. If it is a big hospital, then again, most of the rules which are applicable to public hospital places will also be applicable to private hospitals. But there is a difference here. The difference being this, that the client, the patients are demanding because they are paying patients and the chances of litigations are also higher. So these two things add to the stress which can be generated. But apart from that, if the sizes are comparable, then the public hospital factors will also be applicable to the private hospital. And now coming to private practitioners, which most of you are, I think all the factors which I mentioned, most of you are going to fail on all these levels. Now let us come to traveling. Your stress is going to increase all the time because you are always on the move. You do one case in Dahisar, then the next case is in Malad, the third case is in Borivali, the fourth case is in Borivali East, the fifth case is in Kandivali West, one case is in Mira Road. So you are going to be traveling on a hourly basis or 2 hourly basis, depending upon the size of the case that you are doing. And that travel, given the traffic and the heat, which I have already mentioned, adds to your stress. The type of work keeps changing. Supposing you are giving ECTs in the morning, then maybe after 2 hours it is a eye surgery, or after another 2 hours it is maybe a general surgery. You may be doing varicose veins. The type of work keeps changing. The place that you are working keeps changing. The people that you are working with keeps changing. The quality of the OT and the quality of the personnel in that OT keep changing. So all these factors keep you on a guard throughout the day. Lunch, that is food, is always a problem. I have yet to see a practicing anesthetist who meets his 1 o'clock to 1:30 lunch interval. It is just not possible. That maybe if you are having a day off, then you can eat your food at home. But if you are on the move, then getting your lunch at 1 o'clock, or in the 1 to 1:30 range is just not heard of. I think you will agree with me. And sleep, disturbance of sleep. It may not happen on a daily basis, but the fear is always there that any time an emergency will come, and I will be woken out of my sleep. When I spoke to a few of my friends about these factors which are affecting their life in terms of stress, all of them were of one opinion that this is impossible to change. This just cannot change because we normally work for our friends. We have been with them in college. We have operated for them. We have given anesthesia to their operation even when we were in colleges. And now that they have specialized in different branches and they have settled outside, they have put up their nursing homes in various places of the city. We continue to work with them, and therefore we have to travel. And obviously, it is going to be a mixed plate because they have all specialized in different branches. So, maintaining the friendly ties means that you are traveling to different parts of the suburb and you are operating on different kinds of surgeries. What I want to say that although I agree with this contention, just putting the word that it is impossible to change makes it completely difficult. If you have a more approachable attitude, like let me see what I can do about it, then maybe changes can come about. Not in terms of the people that you are operating for, but at least the other parameters, which like food, eating, etc., which can be manageable. Now, after having said all this, let me give some suggestions about stress reduction. How can stress be reduced in these people? I have got a few suggestions which I put forth before you. And what I am going to borrow from is the public hospital. What do I see good in public hospitals that may be perhaps transported to private practice and maybe you can utilize it for your own benefit? The first thing is that in private hospitals, the good thing is group practice. Now, how would group practice be beneficial if you can achieve it in private setup? Supposing you are working in a group of 4 or 5 people, each one starts his case in the morning and is aware of each other's location. So that when the next call comes, you are able to place it to the closest anesthetist who may perhaps answer that call. Now, some of you may be skeptical that if we keep on referring patients to our own colleagues, we will have loss of revenue. But that need not be so, because if all of you are working truthfully, then if you refer something to someone, then the other person is also going to refer something else that comes to him to you. So it all actually evens out in the long run. The another suggestion was about sensitization of the surgeons that you are working with. And here I would like to just give a realistic story about an anesthetist, a lady anesthetist who had come to give ECTs for me. And that day she was in a bad mood, and it just happened mentioned in the way that she would like to become a surgeon in the next life. I asked her why. She said, strong words are used. We are kept waiting by the surgeon. Maybe there is some undercutting. Anything that goes wrong in the OT is because of us. And the payments are delayed from time to time. So I asked her, what exactly will you do if you become a surgeon in the next life? So she had a rider there. Not only do I want to become a surgeon, I want my current surgeon to become an anesthetist. And what will you do? Will you set a good example that you will not do all the things that he's doing to you? She said, no, I want to take revenge. I want to do all those things to him that he is doing to me just now. She was in such a revengeful and angry mood. Then I had to warn her that maybe, madam, you are actually paying for the sins that you committed in the previous life. Maybe last time you were the surgeon and he was your anesthetist. And he must have, maybe, just as you are cribbing just now, must have cribbed and asked of God to make him a surgeon, and that is what you have got. So don't continue the cycle of rebirth into different complementary but antagonistic vocations. Maybe you can perhaps learn some stress relief factors and stress relief techniques from psychiatrists and resolve this problem. So now, before I wind up, I would like to uh, talk about another small thing which I think only anesthesia people are likely to be facing. See, whenever you go into personal difficulties, whatever the cause, see, whatever we have discussed so far is only a generalized way of understanding the stresses that you face. I have referred to nothing specific. Not that you cannot have specific problems like family issues, husband-wife problems, mother-in-law problem, financial problem, some installments to be paid, some problems with your nursing homes or this or that. All kinds of things are possible. But what I want to say is this, that if you are facing problems, then because of your work, you have got a proximity to a lot of anesthetic agents. And I have seen anesthetists actually abusing 14, ketamine. These are two common things which I have seen anesthetists abusing. You should not be doing that. Among the tablets, I have seen alprazolam. Alprax apparently is very popular with anesthesiologists who are facing troubles. Tapentadol, another orally administrable tablet. So, if at all there are some difficulties, please do not self-medicate, because this is not a surgical thing that you are doing. See, anesthesia, because it is a surgical line, wants immediate and total results. You do not have the patience to understand psychiatry. And psychiatry is a long drawn out thing. You may be under counseling or under treatment for a very prolonged amount of time. So self-medication should be avoided if at all, and approach good psychiatric friends. We do have thick skins. We don't convey anything to anyone else. Everything is kept in our minds. So your secrets and your ideas are all inside. They remain there and they don't come out. Now, before I hang up, let me give a stress buster recipe for all of you. 8 hours of sleep at night, mandatory. If you can manage it, good. Maybe some exercise. 10 minutes of exercise. See, there are a lot of videos you can see on YouTube where you are allowed 10 minutes of exercise. Maybe it is Surya Namaskar, sit-ups, push-ups, wall stands, or playing with the ring around the abdomen. Do something for 10 minutes to just utilize all the sympathomimetic substances. Let the endorphin be secreted. 10 minutes is good enough. Then if you have got the talent, you can uh, have the hobby of playing flute or playing piano or some other instrument. which is a musical instrument, it adds to your life. Nothing like it. It will perk you up. Then have a nice breakfast, maybe along with a newspaper and sitting next to your spouse. After that, when you are in the OT, a little music, very soft music. It is a soothing experience for the patient as well as the doctors, the surgeon and the anesthetic both included. In the evening, maybe you should be on your hobbies and activities, and preferably some vacations, a weekly vacation, 1 day off is good, 3 monthly, maybe 2, 3 days off, 6 monthly, maybe a week vacation, yearly, maybe 2, 3 weeks vacation. Spend your money, use it for your own good and your happiness. And that is, I think, a good recipe for stress busting. I thank you very much for patiently listening to me. I hope I have given you some suggestions. If they are worthwhile, do accept them. If they are not worthwhile, just relegate them to the dustbin. Thank you.
Thank you very much, sir, for the wonderful session. It was like we can keep hearing you for hours together. Thank you very much.
Thank you very much.
So you have made some pointers. You have given me some questions like substance abuse. So many of the medicines like narcotics and ketamine is very, very easily available to the
Yes.
anesthesiologist.
And even fentanyl, even fentanyl.
Fentanyl, yes, fentanyl, opioids, morphine, fentanyl, it's very easily available. Midazolam, diazepam, we have it in our kitty only. So if someone is having some dependence or abuse, how to overcome it, or it has to be sent to a de-addiction, or how do we go about it?
Firstly, let me tell you this, not necessarily because you are an anesthesiologist. Any person who is addicted to any substance, he is extremely difficult to cure. I am extremely ashamed to say this, very much ashamed. Let me tell you that all these so-called rehab centers, which work not necessarily for porquin, etc., but the standard products which are available in the streets, like Garad, MD, Charas, Ganja, Bhang, whatever. See, they do not give a cure rate at all. They only give a abstinence rate. I could keep him off the product for 3 weeks, 4 weeks, 6 weeks, 10 weeks, 15 weeks. Relapses are extremely high. So with this in the mind, you have to start thinking. Okay. So therefore, I said it is easier not to fall a prey. See, why does an anesthetist fall prey to this addiction? He falls prey to it because he wants to self-medicate. But self-medication is not a good thing. If you are having difficulties, which is a natural process of anything, please come to a doctor who can give you regular medication. And the reason why anesthetists self-medicate, it is out of shame that you do not want to tell your secrets to a person who may perhaps be feeling it to, because all of us are going to be friends only working together. So you do not like to share your secrets for the fear of spreading them to other people. But remember, psychiatrists do not, they have a thick skin, nothing goes out of our mouth. It remains there, and we are there to help you. So before you become an addict, take care and come to a proper psychiatrist.
And sir, how to relieve daily stress? Does yoga, exercise, and
Yes.
this thing, spiritual practice or prayers help in some form or the other, sir?
Yes. See, I have already mentioned exercise. Yoga is a form of exercise. If you are interested in doing yoga, excellent. You can practice it. No issues. Even 10 minutes of exercise is good for stress relief. That is what I pointed out. It can be yoga, it can be whatever, it can be a sports also. See, some people like to play badminton, some people like to play table tennis. All that is acceptable. Anything that makes you run around, that is a good stress busting exercise.
And sir, one more thing, how to overcome the blame game. In anesthesia, whatever we do, the blame comes on us. Whether the patient is, if the patient is good, there is no blame. If the patient turns out to be bad, if the patient has delayed recovery, if there's any bleeding, more bleeding, then also anesthesiologist is responsible for everything. How to overcome that thing?
Firstly, let me tell you this, that it does not depend upon your personality. It depends upon the personality of the surgeon. If the surgeon is magnanimous, then obviously he is not going to be blaming the anesthetist. You remember, you have to select out the people that you are working with. Although you are not good judges of personality, you have to remember this, that whatever you are describing, It will happen only, and even friendship does not answer this question. It is only the basic personality. If the personality is a conceited, self-centered personality, grandiose personality trait, then these are the people who are like to pass the paranoid personalities. They do not accept self-blame. They are always likely to project it onto somebody else. You can't do anything about it. So you actually have to be selective about the people that you are working with, and you come to know that. See, I have had an observation like this, that most people, it somehow percolates down to that. Select out people of their own personalities. The people that I am working with, whatever anesthetists, they are all like me. I will use a word sattvic for them. Okay. And a tamasi person selects out tamasi people for him. They have got a particular personality trait and they work on that similar line. You are actually selecting out persons who are of your own personalities. And therefore, if you are unlucky and you are with such a person, then you are going to be blamed for it. But then obviously you have to have technical expertise first. Don't make mistakes. But if you are making mistakes, then obviously the opposite person is the one. I can tell you one example of my. See, I was giving ECTs. This is only one experience in my life in 39 years of practice, that a patient died during ECT. Okay, patient died during ECT, and well, the anesthetist was there. I was there. What happened? Nothing. I completely covered it up. The policemen came. I just told them that this is what has happened. You should do a post-mortem. The body was shifted to Cooper Hospital. They found nothing in the post-mortem. So no blaming the anesthetist. I took everything on my shoulders. The police came. The police investigated. Nothing was found in post-mortem. It was just a technical. God knows what happened. I am even to date I am not aware why should a person die in anesthesia in during anesthesia in the ECT. But there was no self-blame. There was no blaming the anesthetist. Whatever was done, I took it on my shoulders. Anesthetist went for his next case. So you have to find out good people to work with.
Very rightly said, sir. It is like a team game. It is not an individual game. Surgeon cannot do a surgery by himself. He needs an anesthesiologist and the staff to be working with him.
100% right. And therefore, he should be of the personality to give equal weightage to you. He should not be stealing the show.
Yes,
He should
sir.
understand that he may be holding the knife, but it is a team game.
Yes. And one more thing, sir, if means we have our practice almost 10 to 15 years of our practice, and then we keep going to a certain place in freelancing, and suddenly for no reason out of the blue, we stop getting calls from that place. So we get attached to that place or somehow or the other. And if certain situation comes, how to overcome that?
See, if you are being not called again, then there has to be some reason for it. No, either you have made some technical mistakes, or you
No,
have
sir.
become too
Sir,
costly for the surgeon,
it happens
or you
without
have
any
become too
reason.
costly for the surgeon. Maybe he has found the anesthetist who takes lesser payment.
Yeah, that can be the reason, but most of the times it happens that for no reason the calls are stopped after 10 to 15 years, and that generally hurts the
Don't
anesthesiologist.
ever believe that. Don't ever believe that. See, philosophically it is said that ये भगवान की दुनिया में झाड़ का पत्ता कारण के बगैर हिलता नहीं है. Understood that? So be slightly philosophical. Never be of the opinion that something has happened without reason.
Okay.
Either there is some issue on your side or there is some issue on the surgeon side. And if your relationship is above materialistic things, then they don't break. Remember always, if you have found a person of your own personality, see, these are difficult questions to answer, what you're asking. But let me tell you, just in a nutshell, that if you have found a proper person, then the relationship will never break, whatever the outcome. But if it is only a material relationship for money and maybe you are accessible, then that can change. When a better person, more accessible, cheaper, immediately available, all these matters come up. And when that happens, then the relationship changes, because it was a superfluous relationship. It was only a material relationship, not a human being to human being relationship.
Okay. Thank you, sir. Thanks a lot for the wonderful session, sir. Over to Amula, ma'am. Ma'am.
Now, there is one more
Amula
thing.
Parekh,
Hello.
ma'am.
Can I continue for half a minute?
Yes, sir. Yes, sir.
Yes.
Yes,
Okay.
sir.
See,
Anytime.
Yes, just one passing. See, when I joined this session, that girl was talking and somebody
Yes,
had
sir.
asked her a question. Okay. Now, that
Yes, sir.
question I want to answer for everybody's benefit.
Yes,
See,
sir.
wherever there is a person with any psychological problem, and not because I am a doctor and you are a doctor, huh? Any person with a psychological problem needs to be referred to a psychiatrist first. Let him decide whether he requires medications or whether he requires counseling, and let psychiatrist be the person who refers it to a clinical psychologist, counseling psychologist, behavioral therapist, whatever. So your duty as a physician, primary physician, would always be to refer any patient. You cannot decide whether he's going to be for counseling. See, this is the kind of decision which a lay person takes. He feels that taking tablets is something nonsensical and chronic and it will not be stopped anytime. So let me go to a talk therapist. But then those people are not necessarily good for talk therapy. There are certain specific indications in psychiatry which are only drug manageable. So never do this mistake. Any person who requires psychological intervention of whatever variety, your primary referral point has to be a psychiatrist only and psychiatrist. Give the specialist the right to decide what he wants to do, whether he wants to give medicines or whether he wants to refer for yoga or whether to a clinical psychologist. Whatever it is his decision, not yours. Okay?
Okay, sir. Thank you, sir. Thank you, sir.
Chalo. Bye. Thank you very much.
Yes.
Thank you. Thank you so much, sir.
Can I disconnect now or any
Yes.
other questions are there?
So we are done, sir. Thank you, sir.
We are done. Okay. Thank you. Bye.
Bye, sir.
Thank you. Thank you, sir. So after these wonderful sessions on mental health and how to overcome problems in our day-to-day life, now we move on to our next topic, that is organ donation awareness and how to decide a person is brain dead. So our speaker is going to be Dr. Mehul Shah. Before that, I would just like to speak a few words about Sujata Ashtekar madam, since she has also joined. And I would just say that madam is doing wonderful work as far as this organ donation awareness is concerned, and she is a coordinator for all these lot of organ donations. She is a consultant IEC, regional cum state organ and tissue transplant organization, Western region and Maharashtra. She has been associated with Zonal Transplant Coordination Center, Mumbai since 2000. She is presently associated as Awareness Activity Chairperson. She has worked as a Senior Transplant Coordinator and has been associated with the cause of organ donation for more than 24 years. That's excellent work you are doing, madam. And if you are online, could you please unmute yourself and just say a few two words if you can? Are you there,
Thank
madam?
you. Yes, I am there, madam. Thank you for the kind introduction. I just want to say all the organizers, Dr. Mehul Shah, and all the participants of this group for giving the most valuable thing in today's world, that is time, for this noble cause of organ donation. And we have been thinking about various ways to cope with our stress. I feel one of the ways is doing one good act, because देने का मजा पाने से कम नहीं है. When you give a gift to someone, our loved one, and when we see happiness on their face, I am sure we all feel happy. Imagine when we give gift of life to 8 people, what happiness we all will feel. And maybe we will not be there to experience that, but in our lifetime, when we make our pledge, we will be contributing. So I request all the participants and all the respected members of this group to take 2 minutes today and do a good act of organ donation by pledging online. There is an online pledge. I can share on the group also if you want. I'm sure Dr. Mehul Shah will be covering it. But we can now pledge online. So and on from our phone by entering Aadhaar number. So that is all. Thank you, ma'am, for the
Madam, you also, I'm sure Dr. Mehul Shah will be sharing, but if you can also just write it in the chat box, madam, the link.
Yeah, sure, sure. Yeah,
Yeah.
sure.
Thank you. Thank
Thank
you
you.
so much, madam. Thank you so much. Over to you, Dr. Yogendra.
Thank you, Sujata ma'am. I would like to invite Dr. Mehul Shah. Mehul Shah sir is working in HN Reliance Hospital as the chief intensivist and head of the surgical ICU unit. Sir is an executive member of ISCCM. He is a DNB guide and he is a teacher of IDCCM as well. He has received his executive training in healthcare management from ISB, which is a very reputed institute, and he has authored more than 10 research publications. His areas of interest are organ donation, mechanical circulatory devices, infectious diseases, and digitalization of ICU. Over to you, Mehul, sir.
Hi. And at the onset, I'd like to thank, you all can hear me?
Yes, sir. Audible, sir.
Thank you. Thank you. I'm just going to be sharing my slides. Are my slides visible?
Yes, sir. Full screen, sir. Yes, sir. Great.
Thank you. So at the onset, I think I'd like to thank Sujata madam. She set the tone of the talk. And I was wondering, in this mental well-being, how will the tone be set for the talk? And I think she's really put a very good point across. The happiness that we get by saving 8 lives is tremendous. With that point, I'd like to take you across with a brief on organ donation and brain death testing. Again, thanks to the Indian Society of Anesthesia Borivali branch, as well as the Society of Anesthesiologists of Maharashtra, to invite me over here for this talk. And without further ado, I'd like to start. My slides are clearly visible, am I right?
Yes, sir.
Thank you. So we go on with this first case, a 40-year-old female, poorly controlled hypertensive and brought to the hospital in a state of unconsciousness. On examination, her GCS is 3/15. Her pulse rate is 48 and her blood pressure is 210/100. She's unresponsive. She was intubated for airway protection. So a woman lies in the bed at a hospital, aided by the ventilator. Her lungs inflated and deflated and fill again. Her heart beats and her skin is warm, but her eyes stay closed and she does not react to any stimulus, such as pain and light. Is she alive or is she dead? Let's take you across to important definitions by the Indian Act of Death. The legal definition of death as per the Birth and the Death Act is defined as irreversible cessation of all biological functions that sustain life. And it has certain criteria: a cardiac death, which is traditionally death defined by stopping of the heart and cessation of breathing, and brain death, that is defined as irreversible cessation of all brain functions, including the brainstem, even if the heart continues to beat with an artificial support. So we've got 2 types of deaths that we are aware of: brain death and cardiac death. Both reversibility is not possible. Breathing is not there, but the heart beating continues to be in a brain dead person. So let me ask you, when you are born, you've been declared alive when the child cries or he breathes. So birth is defined and dependent on the person's breathing and respiration, along with the heartbeats. Death is also equal to brain dead, or I would say a brain dead person is a dead person. With regards to the legal aspects of brain dead and organ donation, we have a legislation called as the Transplant of Human Organs Act 1994, which have been amended a couple of times in the recent 2011. And they say that this brain death certification requires a panel of 4 doctors, including a neurologist, a surgeon, a medical superintendent, independently doing these tests. And what is the importance and the need of doing these brain death testing is because we need organ donations. What is organ donation? It's basically removing healthy organs or tissues from a live or a recently dead person to be used to another person who is in end organ failure. And there are 2 types of organ donations that we can learn. One is a living donor, and the other one is a deceased or a cadaveric donor. A living donor may be anybody who lives and is healthy and can donate his or her organs, like the liver or a part of the liver and the kidney. When the person is declared brain dead and can help the recipient to save more than nearly 8 organs. So one donor, a brain dead donor, can save up to 8 lives through organ donation and can heal up to 50 through tissue donations. In India, nearly 5 lakh people are awaiting or die because of unavailability of organs. And this scarcity is definitely growing. The organ donation rates in India are so dismal. You get 0.3 per million deaths as compared to the Western world, where it is 36 per million deaths. And in the US, approximately around 26 donations per million deaths. So there are certain reasons why these are there in multiple, in all these other countries. And we'll come to some of them. So this is one of the last year's census. And I wonder if you can find where you see India in this whole graph. Yes, it's the last one. That is the rate of organ donations per million that we have in our country. And this is the census of the amount of donations that have happened across the country with regards to the different organs. And as you see, the highest being the kidney, then the heart and the lung, and the liver also. So organ donation is not only the need of the hour, organ donation is the need of the time. And we salute to the donors who are the real heroes of life. One organ donor can save up to 8 lives. Please remember that. They can donate a part of a healthy donor, that is a living donor, generally gives, as I told you, a part of the liver, kidney, bone marrow, part of the pancreas, certain blood vessels and skins. Where a brain dead donor can donate kidneys, liver, heart, lung, eyes, pancreas, intestines, and tissues and bones. So for our knowledge, how long do these organs remain viable? So after a brain dead person, these organs remain viable for around 4 to 6 hours. And the liver generally, if it is kept well perfused, remains viable for 12 to 18 hours. Now, let me take you through to the process of the organ donation or brain death, and then I'll take you to the process of brain death testing. So, a brain dead donor is identified. I'll tell you how we identify them. Once they are identified, there is a certification for brain death, which is, as I told you, is done by 2 committees or 2 groups of people consisting of 4 doctors each. Once they certify that the patient is brain dead, there is a counseling and a consent for organ donation that is taken from the family, and details and the tests are then uploaded onto the website of the state or the regional organ donation transplant committees. That is, for us, the ZTCC or the National Committee or the State Organization Committee. These are all computerized matches which do happen, and institute-wise, the waiting list of the donors, including different cities and then different states. So the hierarchy of the match is generally that institute gets the preference first, the city donors then get the preference, and then it goes to the state. Once that is done, there is a recipient call that is made and preparation which is done for the recipient. Subsequently, the Organ Donation Act is taken forward. The patient is then, the organ donor is then wheeled into the OT, and the organs are retrieved. The patient is then surgically closed, and the body is then handed over to the family along with the death certificate. Now, this all are generally governed by organizations in our country, which are the National Organ Donation and Tissue Transplant Organizations, which then have a regional body and a state body and then a zonal body. There is a fine line of difference where people need to understand between a persistent vegetative state, where a person may be having a depressed level of conscious, but still has his brainstem functions intact. That means he still can breathe with or without support. The patient may be vegetative, but may respond to a pain, loud sound, and may have a sleep-wake cycle and exhibit involuntary signs. A person who is vegetative can remain vegetative for years with an extremely poor outcome of recovery, chances of recovery. So coming back, what is the definition of brain death? It is an irreversible cessation of the brain functions, including the brain stem. A person who is brain dead is dead and has no survival chances. So let's understand, how do we test for brain death? A normal brain has a cerebral cortex, the brain stem, and the reticular activating system. And the functions of all of them are well known to us. But the brain stem is important for regulating most of the body's autonomic functions, which are essential to life. That is breathing, the heartbeats, the blood pressure, the swallowing. So what are our objectives to identify whether the patient is brain dead? That is to diagnose and confirm that these signs are even present on a mechanically ventilated patient. And there are certain set neurological criteria that we will understand as we go. So what are the first question? Before we identify or certify someone to be brain dead, is there an evidence of irreversible brain damage with a known etiology? Let's take, for example, this CT scan, or let's take, for example, this CT scan. There are very clear images which over here show intracerebral hemorrhages, large areas of infarcts which are there, and involving more than half or more than 2/3 of the brain, which are all suggestive of severe, irreversible brain damage. So we know the cause. Well, we need to be aware of when and certain red flags before we diagnose this patient to be brain dead. A, testing needs to be done within 6 hours. The testing should be done within 24 hours. If it's done within 24 hours in a hypoxic brain damage patient, you could have problems. In patients who are hypothermic, you should not be testing them with patients with hypothermia. Neuromuscular residual paralysis, prolonged fentanyl infusions, and patients whose primary etiology may be located at the brainstem, or some of them who've undergone a decompressive craniotomy. What I'm trying to put forward is that these would be the caveats, or these would be certain signs that we must be aware of before we diagnose a patient to be brain dead. So we have certain prerequisites. First, no sedation onto this patient for the last 24 to 48 hours. no neuromuscular paralysis in the last 24 hours. We need to keep a rectal temperature normally between 36 to 37 degrees temperature centigrade. These are rectal temperatures or core temperatures. So no hypothermia, no hypoglycemia. Try to have relatively normal levels of sodium between 135 to 145 or according to the lab value. However, this is not a absolute contraindication for brain dead testing. Try to have normal electrolyte levels. Maintain an adequate blood pressure with or without inotropes. Avoid to do it in patients who get hypoxic or who will get hypoxic if you disconnect them from the ventilator. Try to correct the acid-base balance prior to doing any of these testings. So these prerequisites need to be kept in mind prior to commencing the set of brain dead testing. What are we testing? There are two main things that we do. One is the brainstem reflexes that we test, and the other one is something called as an apnea test. So the absence of these brainstem reflexes and apnea test being positive certifies the patient to be brain dead. So we're all aware of these reflexes done by the brainstem. I'll show you all in a couple of videos down of how do we test it. And the equipment required then are bare minimum. So let's go down to understanding how do we do these. And I'll show you in short videos where one of my colleagues has performed these testings with the permission of the patient. So here I'm trying to show that heart rate, blood pressures, and oxygen saturations on the blood gas and all are fairly comfortable for us to go ahead for a testing for brain death. So the first thing that we're trying to do over here is checking for the responsiveness of the patient. There is no responsiveness that we see in this patient. We're giving a deep painful stimulus. So a deep painful stimulus is done in the form of giving a grimace. So pain to the supraorbital region, nape of the neck, any of these are enough to see whether there is a frown on the face or any facial activities which you are able to pick up to these nerves, suggesting that there is these nerves which are originating from the brainstem are not having any response, hence there is a brainstem dysfunction. Then the next thing we go ahead to do is check for pupillary signs, and we see bilaterally dilated pupils, right? And there is no response to these pupils. They are dilated and they are fixed. And the next thing is we try to lift the eyelids and look at, I'm so sorry. We look at, we lift the eyelids and we look at a corneal reflex with a wisp of cotton across the cornea on both the eyes, and we see that there is no corneal reflex. There's something called as a doll's eye movement. This is when you move the head from one side to the other side. And in a normal person, if you move the head to one side, the eyes go to the other side. In a doll, when you move the head to one side, the eyes follow that side. So it's like a doll's eye. And then we check a vestibular ocular reflex, in which we take a cold saline and we put it into the external auditory meatus of the patient, 20 ml of it, making sure that there's no wax in that external auditory meatus. And we try to see whether there is any nystagmus or movement of the eye to the opposite direction. So it's known as a short form in the form of COWS. Cold water gives movement to the opposite side. We then check the gag reflex of the patient. We take a tongue depressor and touch it on the posterior pharyngeal wall, and we try to see with the suction catheter whether there is a gag reflex which is elicitable. The next step is a cough reflex, simply done by putting in a suction catheter across the endotracheal tube and trying to elicit a cough reflex, which is not seen over here, as you see. So now we've done these brainstem testings, let's move on to something very important, which is called as the apnea test. And that's supposed to be one of the most important gold standard for brain death testing. The prerequisites for these apnea tests are you need the patient to be well pre-oxygenated. You need him to be cardiovascular and hemodynamically stable with or without a good amount of support with inotropes. And we disconnect the ventilator and attach it to oxygen, around 4 to 6 liters of oxygen, which we attach it to. And we wait and we try and see whether we are seeing any visible movement of abdominal muscles, trying to locate whether there is any breathing reflexes that can be seen. Along with that, we monitor the blood pressure and the saturations. You all will be wondering that whether the saturations do fall. No, they take a good amount of time for them to fall, so they are maintained with that oxygen. Normally, we take a blood gas prior, and then we take around 7 to 10 minutes before we do a repeat blood gas. The rule is that every 1 minute, there is a 3 millimeter rise of mercury in the carbon dioxide level. And if we are able to increase the carbon dioxide to 20 more than the baseline, like you saw in this, that after 5 minutes, it has gone from 40 to 57 or to 66. That is enough of carbon dioxide to generate an acidemia in the ABG, which is a good trigger for the brainstem to breathe. So absence of any of these will be suggestive of that there is an apnea test which is positive and the patient is brain dead. There are a lot of ancillary testings which can be done, are not regularly advocated. Like we all say, tell them to do an EEG, tell them to do an evoked potential, let them go down and get a CT scan. These are not recommended, and they're only recommended in special situations. Like, for example, if you have a posterior cranial fossa surgery, or if you've had a brain maxillofacial surgery, where any of these common tests for brainstem testing are not able to be performed. There are certain mimicking signs which can misdiagnose. That is a Lockton syndrome, neuromuscular paralysis, hypothermia, drug intoxications, which I told you should be always ruled out. So who can do these tests? So 4 medical officers can certify. For an adult, 2 tests are done 6 hours apart. For a pediatric, 2 testings are done again 6 hours apart, but a neonatologist or pediatrician needs to be there. And this needs to be then signed by the intensivist head of the institute. And then the organ donation team comes into the picture. And there are a couple of these 3 forms that get documented and signed. And even in an MLC case, we can still go ahead and do this. So what is the whole crux of this lecture is something which is called as opt-in. And this is what Sujata Madam had suggested. And this was one of the reasons where our country has a very low amount of organ donations. That's because we have a program which says opt-in. That means you need to get yourself registered and pledge yourself. You can use this scan code and pledge yourself for donating your organs when you are in a situation like a brain death situation. Other countries like Spain, where you saw the highest amount of organ donations, was because they have an opt-out protocol. That means you need to specify on your license that you wish not to donate your organs at the time of your death. So you opt out of the organ donation program of that country. I think at the end, the change is the ending to someone's story. Thank you.
Thank you very much, Mehul sir. The videos were wonderful, and all the signs that were elicited for brain death was very good. And I think we will be using some of these in the ICU as well for during the craniotomy and all. And thanks a lot for the wonderful session, sir.
Oh, thank you.
Tejveer, sir.
Yes. We had a very wonderful session today about the stress management, anesthetists facing various kinds of stress, and in the end, very different, very important topic by Dr. Mehul Shah and Sujata Madam about organ donation. I think it has been a lot of teaching for us today. And if the last part, the organ donation part, that we all should pledge. I had done it in the last webinar when we had. I request everyone to do that, and at least some good we can do, to reduce our stress. And then the most important part now, the Thanksgiving. Before that, on behalf of ISA Borivali, I am the scientific secretary. I would like to thank first and foremost our parent organization, the SAMS, that is the Society of Anesthesiologists of Maharashtra State, namely the President Dr. Anita Nete Madam, Secretary Dr. Rajesh Tagadpalle, and Vice President Dr. Saurabh Berde sir for providing us this webinar platform. I would like to thank all the esteemed faculties, speakers for sharing their time and experience with us, namely Dr. Harish Shetty sir, Dr. Shakib Danish, Ms. Kajal Sharma, Dr. Ajit Nerurkar sir, and Dr. Mehul Shah sir. No webinar can be complete without the participants, so I would like to thank all of them. We had a large number of participants almost till the end. Jenica Technologies deserve special thanks for the seamless operation of this webinar. I can't forget the office bearers of ISA Borivali who have actually made this webinar, who conceptualized this webinar and helped us with their selection of topics and speakers and everything. Dr. Amula Parekh Madam, our President, Dr. Rajesh Rao Sir, Secretary, Dr. Garud Sir, Vice President, Dr. Shilpa Tivaskar, our GC, for their contribution in this. Dr. Yogendra Singh, our today's MOC, for a flawless conduct of the webinar. You deserve a big round of applause, Yogesh. And I would also like to thank Dr. Piyush Vani, who was our MMC observer for today's webinar. With this, I request Rao sir, if he's there, to announce end of the webinar. Thank you.
Amula ma'am is there. Amula ma'am, you can.
Ma'am, please do.
Yeah, I think we have had a very good session on mental health as well as on organ donation. The videos were really good on how to diagnose a brain dead person. So thank you, Dr. Mehul Shah. And I think you've already written in the chat on how to register or pledge for the organ donation. I think Dr. Rao had asked for role of living will in organ donation and who can give consent for organ donation in a brain dead patient. If you could.
Sure. So the role of living will, basically, a person can always go and register himself for a living will. Living will is basically for people who would not want to go on to or would like to have a limitation to their treatment at the end in situations where they would like to limit themselves for certain types of treatment offered to them, may it be ventilator, may it be CPR, may it be dialysis. That's done very importantly when you are in your full senses. It's done in front of a magistrate. Once you do that and you land up in a hospital in a situation which is life-threatening, the hospital generally has a committee which then reviews these living wills, and then with their medical team, that is with the superintendent, with the treating doctor, and with one doctor from the local BMC, will then decide the validity of that living will and will give you an approval for going ahead. Yet there have been very limited cases where they have allowed you, but to be very honest, in our day-to-day practice, we do get a lot of families who come up and tell us that, look, I think my father or my loved one has lived their life and I would not want them to be suffering. So we then take something called as, which is called as non-escalation or capping of treatment, where you are able to sign off and say that I would not want my loved one to probably go on a ventilator, and I'm ready to face the consequences, including, and I know that the consequences could be fatal. So those things are permitted, but they need to be also in the purview of that hospital's jurisdiction. Generally, hospitals do, respect that and approve of it. In case if that living will gets challenged, or if the doctor feels that, or if the loved ones feels that, look, he's given a living will, but there is something like, let's say, for example, he's had an accident and he could have been, he needs to get into a surgery and he could get out of it, then that can be challenged. So that is the reason why the government has always put a board of committee of people who will approve of that, and then it goes ahead. So it needs to go through that process where the hospital, with its team of physicians and the local BMC magistrate body, has one person also given to that hospital who then approve of this living will to say that, okay, this would be called as end of life then. When it comes to the next question with regards to who can register for organ donation, as I said, anybody, I also carry this pledge card in my wallet, and anybody can go onto the website. I can put forward, or we can send you the scan picture. You can just scan that barcode. It gives you a form where you need to enter your Aadhaar card, and OTP is generated from your Aadhaar card to make sure that your identity is true, and then you can register yourself or pledge yourself as an organ donor. So in cases when you are in a situation where you land up in a brain dead situation, and if you are registered, it gets a little easier for people who are going to do an organ donation testing or brain dead testing for you for retrieving organs or doing organ donation.
Okay.
Sir, for the people, ma'am's question was, who can give a consent if the person is not registered?
Yeah.
Who can give a consent if the consent is not registered?
If the person has not registered,
Not pledged
fair
his
enough.
organs.
unpledged.
That's fine. So let's say if you've not pledged your organs and you land up in the situation like one of the pictures that I showed, you had a massive intracerebral bleed, and the team of treating physicians come up and tell you that we have diagnosed this person to be brain dead, then you, as a family member, next of kin, for a male person or a husband is defined as the wife and the son or the daughter. For an unmarried person, it is either the father, the mother, or the siblings. Any of these three people who are their legal next of kins can sit together and give a consent. So, to be very honest, I'm sure none of us have even spoken this to our loved ones that, look, if I'm in a situation like that, please consider giving my organs to or donating my organs. I don't think so anybody sits and has that discussion. These are very uncomfortable situations or discussions. But well, if you look at it in a different perspective, that today, if I am not there, my body can save 8 lives. I can give 2 kidneys, 1 liver, 1 heart, 2 of my lungs, probably the pancreas or the intestine and the skin, and even the bones to anybody, and save 8 lives. And that's a new beginning for a person. So I think when that discussion happens, we tend to then at least talk within each other and say, yes, I think I'm ready for doing that. However, since these discussions do not happen in our subcontinent, the next of kin, as we said, can take a decision, and then it's a transparent process where they can sign off on the forms which are given to the government. Once they sign off the forms, everything is then uploaded. A lot of the tests are done. Basically, an HLA testing is done. The grouping is done. The height, weight, and the whole clinical summary is given to the ZTCC. ZTCC then has a time where it tries to find the best match. As I showed you, the best match is first preference given to that institute where the brain dead or organ donor is identified. So if I'm at Sir Reliance HN Hospital, and if my organization has A positive donor or a brain dead person, and I have an A positive heart transplant waiting, I would get the priority. So there is a hierarchy which is there, which is not decided by us. We do not know who is the recipient, and the recipient does not know who is the donor. Then the call is given by ZTCC. They call the receiving team, who then comes to retrieve the organs after they understand the clinical scenario of the patient. They ask for a couple of tests, and once all of that is passed, they then come for retrieving the organs. It's very important at this time to also talk to the relatives that in case you are deciding for giving organ donation, the final decision of retrieving the organs takes place on the table. So when the surgeon puts a cut and he physically sees the organ in his hand, he still has a right to reject that organ, because it is his recipient who he is going to be taking care of is going to get that organ. And just to take you at that side, that same surgeon has already called his recipient. He's already under anesthesia. He has been opened and he's been kept ready for receiving that organ. And hence we create a green corridor and we take that organ. Once the organ leaves or the organ is retrieved, they start the surgery at that time. But before that, they have to call the patient. They have to do an induction of chemotherapy drugs for that patient. They have to prepare him, take him to the OT, and then the whole process. So it's a very big process. And to be very honest, it's difficult. But at the end of it, I think we've done so many at Reliance. I find it to be very satisfying because I'll end up saving a lot of lives. And that's something very important.
So I think that was a good explanation, and thank you so much for giving us such a detailed knowledge of how things go about. And thank you, Sams, for giving us this platform so that we could have these discussions. And thank you, delegates, for waiting till the end, in spite of it being a almost 3.5 hour webinar. Really, thank you to everybody. I think with that, we will end the meeting.
Yes,
Thank you so much.
Thank you, Mehul sir. And I think after this, after your talk, you will have many organs which will be placed today, sir. Thank you, sir.
Thank you. Thank you. Thank you.
Thank you, everyone.
Thank you, sir.
Thank you.
Good night.
Good night.
Good night.
Thank you, everybody.
Thank you.